Doctors, have you ever witnessed the meltdown of a birth that was clearly a result of a cheating spouse? What was the aftermath? It wasn't at the birth, but I used to work for a urologist who did vasectomies. He did a vas on a guy, then did the requisite 3-month and 6-month semen analysis follow-up tests to make sure it worked. The 6-month test showed no sperm, so the guy was all set to not father children. Fast forward 2 years, and he calls my surgeon fuming, ranting and raving about how he fricked up the vasectomy and now his wife is pregnant. So doc orders another semen analysis. Of course, it comes back totally negative. A very awkward conversation ensued in the exam room that I'd have paid anything to eavesdrop on. The best part is, the couple left the office off, with the wife sticking to her story that she would never cheat on her husband, and the husband in complete denial that she'd ever lie about that. Last I heard they were gearing up to sue or something, but I don't work there anymore so I don't know what happened. Not 100% how semen analysis tests go, but I just laughed out loud at the thought of some dude angrily fapping away like not my kid. I'll show you. These stories remind me of something I experienced firsthand the day after my son was born. The nurse: so your baby's blood type is A. Wife: like me. Nurse: and daddy: me. No, I'm A+. Nurse: you must be mistaken. That combination isn't possible. Nurse: I'll leave you guys to it. Me: pulls out phone and frantically googles baby blood type combinations. The nurse was wrong. Props for checking first before attacking your wife. D. A patient asked if both possible fathers could be in her C-section so that neither would miss the birth of his child. They'd figure out the details later. A friend went through it. He went down a dark path of drugs and we lost touch after a big fight about how he was fricked up all the time and he was wasting his life. He contacted me out of the blue to say that I was right. He needed to step up and be responsible and that he had quit everything cold turkey because he was going to be a dad. Apparently he was going to help his girl get sober and they were going to have this kid and get married. He really got his crap together over the course of the pregnancy. He was clean, got a job, and got a nice place to live. She was not so dedicated. She continued to use pills, and H throughout the pregnancy. She ended up going into labor early at 26 weeks. She gave birth to a premature addicted baby boy. He went directly into the NICU. She stayed in the hospital and visited the NICU until she was released. She then disappeared. She never visited the baby, never called to check on it, didn't go home, just fell off the face of the planet. He however spent every spare second at the NICU with that baby. However, as the weeks passed it became pretty obvious that the baby wasn't his skin tone even out and hair came in. Chick was blonde with blue eyes. My friend is super pale blonde with blue eyes. The baby was clearly half Hispanic. He wanted to adopt the baby but they wouldn't let him. The state took it and it went into foster care. It totally fricked him up for a long time. He relapsed for a while and got into a bad car accident. He spent some time in the hospital and then got everything back together. He's married now to a really nice girl and rapidly had 4 kids that are his with another currently on the way. I find it heartbreaking that they wouldn't let him adopt the baby. Instead of going to a father who desperately wanted him, they chucked the poor child into a dysfunctional system. Not a doctor, but still a relevant story. When I was born, my father was 100% certain that I was not his because his blood type and my mom's blood type couldn't have produced me. He punched a hole in the wall in the hospital and yelled at my mom refusing to sign the birth certificate because I have A+ blood. My mom has 0 neg and he was positive that he had ab neg because that's what his brand new dog tags said. He was in the army at the time. Turns out, they misprinted his dog tags. All his old tags said A+, TL, DR. A typo on my dad's army issue dog tags almost caused my parents to divorce. To be fair, a misprint like that could kill him in other ways. I'm not a doctor, but when my godson was born, the nurse told us about this guy who had gotten 2 girls pregnant at the same time. They both wound up at that hospital just down the hall from each other giving birth hours apart. What a lucky guy. When my mother was giving birth to my little sister, my paternal aunt was also giving birth to my cousin in the same hospital. My dad was back and forth between the 2 rooms often enough to get some looks from hospital staff. My friend was a delivery nurse for the hospital that all high-risk pregnancies go to. They are extremely busy and she has brought a lot of people into the world. She once delivered a baby in the parking lot by herself. This has come up on a weekly basis, but she shared the best story with us. A Caucasian couple come in and the mother is in labor. When the dude is filling out paperwork, the mother takes the doctor aside. She tells him there is a chance that the baby may a different race than the father and to let her know as soon as the baby is born. The baby is born. The doctor turns to the mother and announces loudly, "Congratulations on your white baby boy." I imagine a black couple overhearing that and saying, "Dang, we need to find a new doctor." This is fun. My wife's cousin's third came out black. She's married to the pastiest Irish guy you can find. Their marriage did not end, but this has created an interesting story. Grandma tells everyone that he is just really Native American. Her husband was 1/2 Native. He is now 15 and still, no one in the family will admit that he's black. Late to the party, but one of my colleagues in anesthesia once placed an epidural in a heavily tattooed lady. Apparently she had Steve's lunchbox tattooed above her vagina. She gave birth. The OB-GYN turned to the father in the room and said, "Congratulations, Steve." The guy stated, "My name isn't Steve. No meltdowns or anything, just an awkward moment." Yet another reason to not get a person's name tattooed on yourself. I hope I'm not too late. My mom is a labor and delivery nurse. One time she had a patient whose parents were present during her stay at the hospital. The staff there have a whiteboard with some general information about the patients like blood type, time spent in the wing, and like how far along. This information is nameless for HIPAA reasons and instead has a patient's number. So this patient happened to be the only one in the wing at the time. Her father was walking back from the cafeteria at one point and noticed the board. He stopped one of the nurses and asked if the blood type for the patient on the board was correct. He knew his daughter was the only patient there. It was B+. The nurse confirmed it was correct. Turns out he knew his and his wife's blood type. He was O+ and his wife was A. This combination will never yield a B+ baby. He brings his wife out and just points at the board and this look of shock washes over her. TL. Doctor father of patient in labor finds out his wife cuckolded him 25 years later by knowing his blood type Punnett squares. Late to the party and I am not a doctor but I am white and my wife is black. I am frog belly fluorescent white. Think ginger light. My wife is earthy brown. No one would ever describe her as light skinned. We have a daughter. She had a difficult labor and our daughter was delivered via C-section. She did not really get to see our daughter immediately after delivery. Later in our room she was dozing and they brought our daughter in. My relatives and my wife's relatives all commented on how my daughter looked so much like me and was not even close to the pigmentation of my wife. So I carried my daughter over to my wife and gently woke her and showed her our daughter and said, "I do not think she's yours." We all had a good laugh. My friend told me this story of hers. Woman and her husband were having their first child and it was the friend's first ever delivery. OB-GYN. When she got the baby out she looked at it, then looked at the parents and asked, "Okay, which of you has 6 fingers?" The mother broke down crying yelling "I'm sorry" to the husband. Their neighbor apparently had 6 fingers. When my wife was born, she was very yellow and the nurse quietly asked her mom about the paternity when her dad was out of the room. She was just born with a bad case of jaundice and that nurse was an idiot. Not a doctor, but my best friend's stepbrother was that guy who found out he wasn't the father because the baby was black. I'll try to make it short. Dude had gone to rehab twice and was doing really well. He came back home for a weekend and fricked his ex-GF. Left and went back to his house states away to continue his newfound life. Got the call she was pregnant and dropped everything to come back and be a father. We were really worried he would relapse but he was great. So 9 months of preparation goes by. He was gonna be an awesome dad. All worried about relapsing were gone and he seemed ready to become the best dad he could ever be. Baby comes out. Everybody's happy. Nurse takes him aside after a few minutes and says, "I want to ask you something. You do know that's not your kid, right?" He says, "What do you mean?" "Well, that baby is at least half black, but the pigments are probably going to really darken." So he goes over to his ex-GF and asks if there's any ways what the nurse just told him is true. She starts sobbing and breaks down completely. Admits that she fricked a black guy right around the time he came back. So he says, "Alright, I'm glad you and the baby are healthy. Have a nice life. Walks into the waiting room where all the new grandparents are waiting. Cheers. Celebration. Everything good? Yep. Healthy baby. Healthy mom. I'm not the father. I'm outta here. And walked right out the freaking door. The girl's parents even wanted him to pay and support. He moved back to where he got his life back together and is doing incredibly well. But man, I wish he had all that time back. At least he only wasted 9 months. If she had banged a white guy, they may not have noticed for 18 years. I'm way late to the party with this one, but it's about my mum. She had my brother when she was only 16 and had a very hard birth with him. Back in that time the husband wasn't allowed in the labor room and my grandma was at work. When my brother was born he got stuck, so they had to use forceps, and he was also jaundiced, so he looked like an Asian baby. My grandma turns up after work and is looking at all the babies in the room they were kept and asks which one was her daughter's baby. The nurse points to my brother and him looking all Asian. My grandma storms up to my mum on the ward and said, "Which Asian guy did you sleep with?" Well, my mum thought she was joking, so she said, "I don't know, it was too dark to see." My grandma then proceeded to hit my mum until a nurse came in and explained, "My brother is now 44 and as white can be." Well, my mum thought she was joking, so she said, "I don't know, it was too dark to see." Your mother's a champion for having such a sense of humor after a difficult birth. I might be the first medical professional to post in this thread. Hot dang. So I'm a NICU nurse that was floating to the nursery. A baby was born with a genetic abnormality, had one missing limb, but was otherwise doing fine. The pediatrician was in the parents' room discussing with them the follow-up type stuff for the baby, appointments with a geneticist, an orthopedic surgeon, etc. At some point in the conversation the mother asked what the baby's blood type was, to which the pediatrician responded A+. The father of the baby insisted that was impossible, as he and his wife, this was their third baby, were both O. The pediatrician got totally flustered and came back to the nursery to verify the lab results. Baby really was A+. We even went so far as to redraw the baby's blood and retest it. Nope. A+. There is absolutely no chance that the baby belonged to that man. The husband left the hospital soon after and didn't show up again until it was time to pick up the mom and baby to bring them home. The mom spent the rest of the hospital stay lying alone, in the dark, mostly hiding under the covers. My aunt is white and so was her husband. He passed a while ago. When they finally had a kid, my cousin was black. The family decided to ignore it, my uncle included. This was in 1989. And to gain my young teen cooperation I got an early Christmas gift, a Sega Genesis. Love my cousin. My parents both have blood type O+, while mine is A+. I asked my mom about it when I was learning the basics of genetics in the 6th grade, and she said that the doctor had told her it was some sort of rare mutation. However, now that I'm older and have remembered it, I'm going to ask her about it again, since I'm pretty sure that my dad wouldn't know the importance of blood types, and I'm positive my mom would have lied in order to make sure I had a good dad. Update: my mom texted me back. According to her, both she and my dad are definitely type O+. So there goes the forgetting of the blood type theory. Apparently my dad did know enough at the time of my birth to request a DNA test before he signed the birth certificate, and it came back as a 99.8% match, which he only told my mother about after the fact. The cool part is that the same thing supposedly happened with my paternal grandmother, who also had type A blood, but was conceived by 2 type O parents. There is always a small chance that my mother is being untruthful, but I don't see why she would be at this point since I'm grown. Plus, my dad and I share similar physical features. I hope you all enjoyed the update. Update 2. Thank you to whomever gilded me. I'm blonde and the hubs is ginger. Our daughter came out with black hair and jaundice, so she looked very Jersey Shore. Those first pics of us as a family are hilarious. After about 2 weeks, her hair turned to an auburn and her skin tone is pale like us. I won't lie, for a second I wondered if the husband had cheated. Not me, but this was an odd one that I heard because I casually knew one of the parents, the father to be exact. He came in freaking out because his wife had a kid. Well, he was white, she was white, kid was born a dark mulatto. He instantly dumps her and starts filing for divorce. She has no idea what the heck happened. She forces a DNA test on him before she'll do anything. 3 months later, well, turned out it was his kid. Her parents, his parents, everyone thinks he isn't, but his mother apparently had a black grandmother, so the genes came through extra strong somehow in their kid so many generations down the line. Safe to say they are going through a heck of a lot of therapy. She never cheated on him and he never believed her despite all her serious protests. Been about a year now and it's better but still not perfect. I volunteered at a hospital and a Mexican couple had a very black baby. The guy was P and basically said it was while he was in jail, wasn't it? Well, if he was in jail then how did she get pregnant by him? This happened in my immediate family. My mother is white mix American, brown hair and green eyes, married a full-blooded Japanese man. My 2 younger brothers and I are very, very obviously half Jap. I got the black hair, brown eyes, and a slight cast to my eyes. My brothers look Jap as frick in the face, with brown hair, moms, and lighter eyes. After the 3rd kid, things weren't going so hot with my mother and father. Lot of fights, lots of nights where I would wake up, at the age of 5, and find my dad slept on the couch. Mum gets pregs again, even though they only had sex once after my youngest brother was born. Their relationship continues to deteriorate during the pregnancy. The big day comes. Out comes my baby sister, last of the bunch. My sister was born white, with a shock of bright red hair and a very pale complexion, and no Jap features at all. My father's best friend was a tall Danish red-headed dude. It took my father about 36 hours to put 2 and 2 together. He confronted my mother in the hospital, and she admitted she'd been fricking his best friend behind his back since before my youngest brother was born. Divorce happened not long after that. My father ran the frick away from all of that bulls. Funny thing, I didn't realize my sister was from another father until I was 16 years old, and my girlfriend asked why my sister looked nothing like me and my brothers. I asked my mother, and got the full story. To this day, she's not my half-sister. She's my sister. We grew up together, and she my sis. I'm her eldest bro, but yet, it ended the marriage, more or less on the spot. Jap as frick in the face. This will probably get buried, but here it is anyways. My GF's uncle, let's call him Jay, has 3 children. Boy, girl, boy. The 2 oldest are brunette, olive-skinned, look very alike, and have very computational brains. They look very much like their father's children. The youngest child is blonde, fair-skinned, looks nothing like his siblings, and has almost no computational element to his brain. So right after this kid was born, Jay thought something about him was a bit different, just from the blonde hair and pale skin. He didn't immediately accuse his wife of infidelity, but his ears were pinned back. He ends up catching her having an affair within a short period. They reconcile their differences, but it only lasts so long. When their youngest kid is about 4, she leaves him for her partner in crime. He is the blondest, palest mofo of all time, and works in real estate. Jay fights for custody of all 3 children, and wins. He knows his second son isn't his, but he doesn't give a crap. He told my GF's mom that he always knew things didn't add up, but he will always love him as his son and treat him as such, even if there is no DNA shared between them. My parents' cat had 5 kittens, 2 all black, 3 all orange. There is a black male stray and an orange male stray in the neighborhood. She looked a little ashamed maybe. Just one of cat's magical superpowers. Lady cats can get pregnant off of 2 different fathers. Unlike humans, they can have separate but pretty close to timely separate inseminations, resulting in kits that resemble each of the respective fathers. Same with dogs, or so I'm told. My dad was a doctor. He never told me about any meltdowns, but he told me they would deliver a lot of babies for unprepared parents, teenagers, moms and dads with obvious drug or alcohol problems, legal problems etc., generally not ready to raise a kid. For every one of these risky couples, it was usually teen parents who were 16 or 17. He would take a picture of the new mom and dad together holding the new baby a couple hours after the birth, and then a few weeks later he would send the picture to them with a short note about how they will make great parents, and the baby is counting on them and just inspiring words in general. He has a whole photo album of the new moms and dads holding their baby in the delivery room when he was a doctor, and I have to say it is some outstanding photography. Amazing stuff. Whoa, that actually sounds pretty incredible. Not a doctor, but have a similar story to some people here. Met a girl when I was 19, who was always hanging out at my next door neighbor's house. They were Mexicans. The first day I met her, we wound up sleeping together. Yes, I used protection every time. We dated for about a month, and during this time she made friends with some of my friends. What ended the relationship was that she thought one of my friends was now her bestie and decided to tell her that the whole reason she was with me is that she got pregnant by one of the Mexicans next door and that her family is highly racist. So she knew that would not fly. She picked me as it appeared that I had my crap together, was repairing buildings, selling computers, and had planned on lying to me and claiming it was mine. Turned out the day she found out she was pregnant was the day she decided to hook up with me and why she slept with me immediately, so the timeline could be blurred. My friend asked what if I noticed that the kid is not pale white like mother and father are. She replied that at that point she did not care, because she hoped she would get me on the hook to pay for things for the baby and everything else, and if I noticed and walked away she was still winning by having those things. My friend immediately told her to go frick herself and told me ASAP about what was going to happen. You think this would end here, but it did not. She wound up informing her family she was pregnant and that I was the father. They then proceed to lay a campaign of terror on me, because at this point they are considering me a deadbeat dad. They did not listen to me when I tried to explain who the father really was, because their daughter is not a liar. I got death threats from the father and brothers on regular basis. Windows smashed out of my car, slashed tires. Pretty much scared to leave my place, since they only lived 4 blocks away from me. During all this time, the Mexican family moved out of the area overnight, left owing the landlord several thousand and rent and a demolished rental house. I don't think anyone knew where they moved to, as even the landlord came over to our place asking many questions and trying to track them down for a lawsuit. After around the timeline the baby should have been born, the harassments from the family magically stopped and I never heard or saw of them again. I can only assume they got the point when the kid was born. I wouldn't be surprised if the doctor who delivered me and my sister 3 years prior didn't write here saying Indian dad, white mum, kid came out white. Mum definitely cheated, but the dad must have been having a meltdown on the inside. Although, I've looked it up out of curiosity, and apparently skin color is a genetic lottery when the parents are of different races. Not exactly what you're looking for, but made me think of another story. I used to work as a loan officer at a bank, and one of my co-workers was helping a woman dispute some charges on her account. She was going through the charges and she was saying, we haven't bought anything at a jewelry store, and I haven't gotten any flowers from my husband, and I certainly haven't gotten any lingerie or a night at a nice hotel. All these charges must be fraudulent. My co-worker was very gently trying to tell her that the charges were made with her husband's card. Did she check with him? Is she sure no one made those purchases? Etc. You could see the realization come over the woman's face, and she slammed her hands down on the desk and started screaming, I'm gonna kill that son of a b. Security escorted her out, and a few days later the husband was in asking to open a separate account. What and but. The worst meltdowns I ever saw had nothing to do with skin color. Some backwards butt cultures you had to call security if some poor lady gives birth to a girl. Can confirm I'm Indian. Happens a lot here. Ironically enough, I'm reading this from the maternity ward right now. 7 pounds 5 ounces. Looks like me, thank God. Congrats. Hope you didn't like sleep. My husband raised a kid that was very obviously not his. Kid was born and was half back, and he kept his cool. Went outside to smoke a cigarette and throw up. Married the woman, had another kid, this time his. Got divorced when the second kid was 2. Lots of ups and downs with the first kid. She turns 20 this year and they get along pretty well right now. Yes. Woman admitted to hospital on Christmas Eve with abdo pain after she fell over pee as a fart. Routine pregnancy test was positive and the doctor thought that she was either a bit plump or about 30 weeks pregnant, which she was oblivious to. Transferred to obstetrics due to ongoing pain, which turned out to be contractions. Her sister comes in while I'm just writing in her notes. Asks about her partner who apparently was on deployment with army until a month ago. He is already on the way. He knew she was pregnant but not 30 weeks. He arrives. She pretty much just coughs and out comes her baby. 8 weeks preterm but not bad condition considering. He quickly puts 2 and 2 together and realizes it's clearly not his. She genuinely doesn't even know what's happening as she is still drunk. He just leaves and I presume never went back now that he can see what a mess of a partner he has. Next day I review her on postnatal ward and she is discharged although her baby is staying in so she will as well. She asks me what happened. She has literally no idea she was pregnant, admits to having slept with someone but can't remember who, and doesn't remember her partner showing up and dumping her. I felt sorry for her and her child. She might see this as a massive wake-up call and turn her life around but she had everything stacked against her. Single unemployed mother with a baby she was totally unprepared for. Sorry it's not really a funny story. We did call it the Christmas miracle but that's about it. Doctors who have given a second opinion diagnosis. What is the worst first opinion you've ever encountered? Well, when I first started feeling sick the October of 1 year at college I had a non-productive cough, night sweats and trouble sleeping, and I had lost some weight. The school nurse gave me Claritin. All of those symptoms got worse, plus I was incredibly fatigued, my lymph nodes swelled up, and I had pretty bad backaches. My GP took a chest x-ray and prescribed antibiotics for pneumonia. At this point I had almost failed out of school because I was only managing an hour or 2 of sleep per night. It took until spring break for me to go see a pulmonary specialist. He could instantly tell that it wasn't pneumonia. I had stage 4B Hodgkin's lymphoma. My first PET scan showed cancerous cells and lymph nodes in all 4 quadrants of my body. At this point I had lost about a third of my body weight. The cough, weight loss, and back pain were my swollen lymph nodes pressing on my lungs, stomach, and my back. They gave me my first round of chemo and I genuinely felt incredible. I felt like such crap that an IV mixture of carefully measured toxins was an improvement. I went home and ate a whole pizza. Chemo got shittier but it worked, so I guess I can't complain too much. Glad you're okay. What a horribly frightening experience that must have been. Stay with us, friend. Not me but my mom. She was always exhausted, the type of exhaustion that she'd have a bath, be so tired from it, she'd sleep on the bath mat when she got out. Went to her doctor, told her, "Oh, you're just depressed. Go get a haircut." She did. Still exhausted. Went back to the doctor. Continued to tell her she's just depressed. Get a hobby. It's all in her head, etc. Never send her for blood work. Never referred her to any specialist. Months later she goes back. Her doctor is on vacation. Physician reliving her doctor takes one look at her eyes and says, "It's your liver. Get these blood tests now." Abnormal blood work and a liver biopsy later. She was told she had autoimmune hepatitis and was 3 months from death. After she improved with medications, she went back to the original doctor and said, "I didn't need a haircut." 27 years later she still suffers from lingering effects. I'm a surgeon. Most patients come to me after having seen another physician who has diagnosed them with something and told the patient to see a surgeon. I've been called to see more than one patient for appendicitis who has already had an appendectomy. I've also been called in multiple cases for patients who very obviously have previously undiscovered, very advanced cancer. It always too far advanced for me to be of help, so I have to wonder, am I being called so I can be the bad guy and explain everything? Yes, the answer is yes. I have one that happened to me. I did college gymnastics. My senior year I had an accident in practice landing in my neck. Went to the hospital, got x-rays, was told I was perfectly fine. Walked around in pain for a while. Weeks later went to another doc, got a new set of images. My neck was broken in 3 places and had a dislocation. Had a multi-level fusion surgery days later. Found out my X-days got swapped with someone else's in the year and I was originally diagnosed based on someone else's images. This was found out when I went to get my records long after my surgery for insurance purposes and my files had someone else's medical records and images in it. Because of the time I spent walking around with it, I had to have a posterior surgery instead of anterior, which is way more invasive and gives me major issues to this day. I'm a lawyer, but Had a client given a devastating diagnosis of an extremely rare heart condition. Doctor told him he had 6 weeks to live. He contacted me to make his will and set his affairs in order. Thankfully, he sought a second opinion with an extremely well-known cardiologist. I guess the cardiologist was intrigued due to the rare nature of this heart condition. There was nothing wrong with him. He was fine. This poor guy and his family were tortured over this, so devastated and terrified. For nothing. He actually called me to tell me all of this. He seemed to be still in the joyous "I'm not going to die" stage. But I imagine anger comes at some point when you take stock of what you went through. I don't know how a doctor freaks up that massively, or if somehow my client's results were mixed up with someone else's, and some poor bastard's number is almost up and they don't even know it. Not a doctor. My sister was about 2 weeks away from giving birth when she suddenly started feeling excruciating pain and vomiting. I called her midwife, who refused to speak with me despite my sister clearly not capable of speaking, as she sat on the floor next to the toilet, crying and puking. Finally she just took the phone and was told by her midwife that it was probably just a virus and to eat a popsicle. Eventually I was able to convince her to go to the ER. She was immediately rushed in the OR for an emergency C-section. Her placenta had abrupted and my niece was born not breathing, suffered several seizures and even died, and then was resuscitated. She is now 15 and has cerebral palsy due to going so long without the oxygen she needed. Patient. When I was in college I went to the doctor because I was P-raises. It progressed pretty rapidly and by the end of the week I couldn't walk or sleep. The doc asked me about my sex life and I told him the truth, that my girlfriend and I had only been with each other and together for many years. He sorta scoffed at that and told me it was likely chlamydia. Had a long condescending speech about safe sex with me and sent me home. A week later my P tests were back. Turns out I had the worst bladder infection they'd ever seen. I had to have a camera shoved up my pee hole, multiple rounds of antibiotics, and to this day I struggle to pee due to irreversible damage the infection caused. Oh man, that sucks. UTIs are rare in men but super common for women, and I get like one every other year. I've gotten really good at feeling the beginning of one before it gets worse, and I drop everything and rush to urgent care. They hurt. This is the opposite answer, but the best request for a second opinion came from a CVS Minutes clinic. Young healthy law student goes to Minutes clinic. Has the flu. This was a few years ago. No Rona. Feels awful. They check him out. Yup, he has a fever. Sore throat. It's the flu. Flu swab positive. His clinic vitals were notable for a heart rate of 140. A bit high but not crazy high. Reassuring numbers. 100. The guy otherwise walked into the CVS and is a young healthy guy. Would have been pretty easy to dismiss. Anyway, the Minute clinic says go to the ER. You need an EKG. So the guy follows orders. A chief complaint is I have the flu and CVS told me to come here. Gets an EKG and he's in slow VT, which is a life-threatening arrhythmia that you have to be shocked out of. They take a look at his heart and it was giant and barely moving. He had an insane myocarditis. Dude ended up getting cannulated for ECMO within hours. Cardiac bypass machines as life support. I can't say all Minute clinics are the same, but holy crap, that was a great save. I'm a gynecologist. The number of times I've seen patients pregnant and upset, or happy, because some other doctor told them they can't get pregnant, so they didn't use birth control, is appalling. Usually it's family med. Not ragging on all FM docs, just how it goes. I then have to explain that even if the patient has whatever condition that makes it unlikely for them to get pregnant, the odds are almost never 0%. Maybe 1%, but still not 0. So of course it can happen. Not a doctor, but my mom went into a walk-in clinic and told the doc she had really bad headaches all the time. She was a stay-at-home mom to me, 10, and my sister, 6. So it was written off as stress and got a prescription for pain pills. 2 weeks later the headaches were migraines. Stronger prescription and try to reduce stress. A few weeks go by and she can no longer get out of bed. Throws everything up including the meds, is completely disoriented and barely alive. My dad was a truck driver so he was never home. I was taking care of me, my sister, and my mom all by myself. We go back to the doctor and this lady had the audacity to say this is the weirdest migraine case she's ever seen. Tells her to take warm baths and just keep taking the meds when she throws them up. 2 months go by and my dad came home, saw the condition of my mother, who was so sick she would urinate herself, the house, which was being kept up by a 10-year-old, and said he wanted a divorce. That night we found out she had stage 4 lung and brain cancer with a tumor the size of an egg pressing on her brain as well as many others scattered throughout. I still haven't forgiven that doctor for not taking my mom seriously. I just left a practice partly because a woman brought her 8-month-old in for a second opinion. The practice owner had seen the rapidly enlarging sacral soft tissue mass which the mother first noticed about 6 weeks prior. He told her not to worry about it. I checked his notes, which read, plan, ignore. I was shocked. There was a new onset rapidly enlarging blue purple cystic mass on a baby's sacrum. It looked like a small plum under the skin at the top of her bum crack. And without any investigation my colleague dismissed it. I was appalled. The mother was relieved. This wasn't the first not great judgment I'd seen but it was one of the worst. I realized I couldn't work in a clinic where I'd be stepping on other doctors' toes and couldn't trust their judgment. The babies had her imaging and a referral to a pediatric surgeon but unfortunately I don't know the outcome because I'm working elsewhere now. Honestly at that point I'd pull the mother aside in the lobby and say something like if it doesn't improve on its own in a few days, I'd find a bigger place to give you a third opinion. Told by my doctor my health issues were stress related. The second opinion found my gallbladder was functioning at 3% and had that sucker removed a couple weeks later. What's worse is I specifically asked the first doctor about gallbladder and they assured me it couldn't be that. Gallbladders are notorious for causing a ton of seemingly unrelated health issues. After mine was removed my life improved dramatically. Not a doctor. My husband had a situation where he almost died because of a misdiagnosis. To preface this, at the time we were young in our mid-20s living in a college town. My husband had horrible pain. On floor on hands and knees horrible. We went to the ER and the doctor barely looked at him and just told him to stop drinking and he would be fine. We go home, the pain is getting worse and now he is vomiting. As soon as the doctor's off opens back home where we grew up we drove 1.5 hours to see our primary care. Within 15 minutes of walking into the GP office my husband was rushed to emergency surgery. His gallbladder had completely ruptured and he was going septic. It was a total mess and he almost died all because of a misdiagnosis. Not a doctor. Dealt with an unrelated incident and reading a patient's notes found he had been diagnosed with a rare but deadly skin cancer and was booked in to have his upper lip removed. Obviously this would leave the patient quite disfigured. On a whim he'd booked in to see a dermatologist at our hospital, who advised it was a cold sore, prescribed Acyclovir and the problem was resolved. This one astounds me, not only because I'm pretty sure doctors are told not to expect a zebra when they hear hoofbeats, but also because you'd think they would have run a simple test before major surgery. I went to a walk-in clinic because I couldn't swallow anything. The doctor pressed on my forehead and asked if it hurt. I guessed kind of. He told me I had a sinus infection and prescribed me antibiotics that I couldn't swallow and sent me on my way. Turns out I had had a stroke and ended up spending 3 weeks in the hospital. This is the one that really made my eyes bulge. Hope you're well these days. Not a doctor. This happened to my mom like 20 years ago. I believe she was close to 36 at the time and had 6 kids. My mom was having severe abdominal pain, and if my mom admits to being in pain then you know it's bad. Her family doctor was on vacation and so my dad took her to Emerg. Emerg doc told her she was constipated and sent her home. The pain got worse and so she went back to Emerg a couple days later. She specifically asked the doctor, the same one from the previous time, if it could be an ectopic pregnancy. He laughed at her and sent her home. She ended up in Emerg a 3rd time and got that same stupid doctor who accused her of lying to get drugs. She had to wait a week until her family doctor came back. Just over the phone the family doctor could tell something was wrong and told my mom that she wanted to see her first thing in the morning for tests. Mom didn't make that appointment because during the night her fallopian tube ruptured and my dad found her unconscious on the floor downstairs. He rushed her to the hospital and they found out that she was something like 10 weeks along with an ectopic pregnancy. Our family doctor apparently was screaming at the other doctor in the hallway because of his incompetence. Not a doctor, but I went to a dermatologist for a rash on my hands and face. He insisted it was eczema even though I've never had eczema in my life. He refused to do any testing or take a biopsy. He prescribed me a steroid cream for eczema. The rash spread and got horribly worse. It was all up my arms and all over my face. It was itchy and painful. I went to a different dermatologist and explained the situation. They took a biopsy. It was a bacterial infection and the first doctor essentially gave me a bacterial infection on steroids. I was a minor at the time and I don't know why my parents didn't go after the first doctor. I am late, so this may not get seen, but it's a good story. Not a doctor. My grandmother fell from her horse one day. Not a terrible fall, but from the way she landed. She wanted to get checked out. She felt she'd really jolted her neck spine, and was an older lady with fragile bones. Her doctor looked things over, gave her one of those soft neck cushion things and sent her home. A couple days later, she decided to get a second opinion. No real reason. She just hadn't felt listened to by the first guy. The second doctor basically took one look at her x-rays and freaked out. He told her they needed to get her immediately into a brace to immobilize her spine. I googled to try to figure out what it was. I think it is a halo brace, but in my memory it's bigger and more metal than what I was seeing in the pictures. Basically she'd broken her neck. The same injury that had paralyzed Christopher Reeve, but she wasn't paralyzed because the vertebrae hadn't dislocated. The second doctor anything that did dislocate it, another minor fall, twisting wrong in bed, would mean being permanently paralyzed from the neck down. She wore her intense metal brace that kept her spine in place for a few months and was totally fine. She lived another 15 years after that. But I think about that story often. The second doctor saved her mobility and freedom. Obligatory. I am not the doctor but I'm the patient. I went to a sleep doctor because I was constantly tired and falling asleep standing up and such. Serious crap. Doctor was like, well, you're overweight, so it's definitely sleep apnea. I did a sleep study, came back negative for sleep apnea. Doctor was like, well, I'm still positive it's sleep apnea, cause you're a fatty. So he sent me home with a CPAP machine for a month. After a month of using the machine, which records your sleep apnea events every night, and still said I didn't have sleep apnea, and with me having zero improvement in any of my symptoms, I went back to him and he said, well, if this isn't working, I can't help you, because you obviously have sleep apnea since all tubbers have sleep apnea, so you must not be using the CPAP. So I dropped him like a fresh turf and went to get a second opinion. New sleep doc, new sleep study. Come back in and the new doctor's like, yeah, this is textbook narcolepsy. You have all the symptoms and the sleep study proves it beyond a shadow of a doubt. I told him about the other doctor and he said, this is obviously narcolepsy. Your previous doctor was a moron. And, unlike the other quotes in this story, that is an actual, direct quote. I'll never forget the look of disgust on his face when he said the word moron. Also not a doctor. I was diagnosed with MS, sought out a second opinion, and turns out it was an easily solvable vitamin deficiency. Pretty dang different. $15k in medical bills later, only go have all symptoms subside with some nutritional advice and supplements. I'm still salty about it. I had a period of about a year where I was getting constant UTIs, which, apparently, as a woman in her mid-20s is normally caused by not peeing after sex. I'm still not sure what was causing mine, but I was not sexually active at all, due to vaginismus. My doctor was away for school holidays and stupidly, I thought I could last a week until she was back. Nope. 2 days later, I could barely move from the couch in pain. So, I called a doctor. This doctor, a home doctor cause it was a public holiday, refused to hand over the script until I acknowledged that I was being sexually irresponsible. When I said I am a virgin, embarrassing and potentially dangerous statement to make with a strange man in my house while I was home alone, this jackass laughed his butt off and said, no you're not. Nobody is at this age. Stop pretending to be all innocent. Slammed the prescription on my coffee table and walked out, refusing to give me the starter dose that they're required to carry. for people like me who are alone and can't get the prescription until the first dose kicks in enough to begin helping. Full stop. I called the office to complain and he did get reprimanded, but holy heck was I embarrassed. Not a doctor, but my sister was suffering from headaches and minor seizures for a while. Went to an urgent care and that told us she had an anxiety disorder and just needed something to calm her down. We got a second opinion at the ear and turns out she had stage 4 brain cancer. I miss her every day. Posted about this before but I'll post it again anyway. This is my mom's story, not mine. So my mom used to work at a non-profit clinic that would give free healthcare to people who didn't have insurance. This guy came in with his teenage daughter, basically saying he was between jobs and the insurance for his new job hadn't kicked in yet, but his daughter was having her yearly case of pneumonia and just wanted her antibiotics. He was really arrogant and rude, saying stuff like, "She has a Cuban doctor she usually goes to. My mom is Mexican and I live in an area where most Latinos you see are Mexican." My mom, staying calm despite wanting to bite the guy's head off, examined his daughter. She noticed his daughter's fingers were clubbed. Google clubbed versus normal fingers, and this was indicative of a serious, chronic respiratory issue, not something temporary like pneumonia. She asked if she could run a few tests just to be safe, and at first he was huffy about it but was persuaded when my mom told him it wouldn't cost him anything but a bit of time. A few days later, the clinic calls her freaking out because this girl didn't have pneumonia. She had cystic fibrosis. The girl was transferred to a hospital where she could actually start receiving treatment for her condition. It was a minor case. If it was anything more, she honestly could have been dead by that point. But my mom probably prolonged this girl's life expectancy with the diagnosis. Her regular Cuban doctor had been regularly misdiagnosing her with vitamin deficiencies and pneumonia. Later, the father called my mother and thanked her for helping his daughter. My mom was going off in her head. What about her Cuban doctor, huh, a-hole? But was polite and wished him and his daughter well. TLDR. Not really a second opinion. But when a Cuban guy who was arrogant about being Cuban came in with his daughter thinking she had pneumonia, something she was diagnosed with yearly by her Cuban doctor, my Mexican mother diagnosed her with cystic fibrosis and helped extend her life expectancy. Nurse here. I cared for a woman who had been diagnosed with broken vertebrae. She was in a lot of pain, couldn't get her pain under control, and her blood pressure was very low. She'd lose consciousness and be very difficult to wake. I also couldn't get her doctor to answer the phone, middle of the night. Something just felt off about the whole situation. He finally answered and demanded we Narcan her, insisting we'd overdosed her on narcotics. Following his orders, I then had a hysterical woman in a lot of pain going in and out of consciousness. I finally walked down to the entrance of the hospital and grabbed the cardiologist who came in at 4:30 am for rounds and said, "This isn't your patient, but I think she's going to die." He came upstairs with me, looked at her and her chart, grabbed the bed and rolled her to ICU himself. I have no idea how the conversation went between the cardiologist and her doctor. She didn't have a broken back. She had an aortic aneurysm, which caused the pain and the low pressure, and the loss of consciousness. She died the next day. Doctors, if the nurse says something is wrong, you might want to lay your eyes on the patient rather than shouting orders through the phone. OMG, that is heartbreaking. Obligatory. I'm not a doctor, but when I had my wisdom teeth out, it was pretty brutal. Like they had to completely put me under, dig deep into my jawbone. The teeth were coming in sideways and upside down, just like the worst case scenario. So, I have the surgery in the next couple of days. I'm in a lot of pain, which happens, and I realize I have this growing hot lump on the side of my jawbone. Me being a dumbass, I tried to be like, oh, it'll go away, but it didn't, and my mom caught sight of it and took me back to the guy who did my surgery. Dentist dude took an x-ray and without even examining it or asking any questions said I was fine and it was probably just scar tissue and told me to leave. I thought, hey, well, he's smarter than me, so I guess he's right. My mother, however, did not think this. And so off we go for a second opinion, and while we're headed over to the other office, the hard lump in my jaw bursts and blood and pus leaks everywhere in my mouth. It was so freaking gross. My mom immediately turned around, drove back to the dental surgeon, dragged me, who was still spitting blood and pus, barged into the office, and made the dental surgeon look in my mouth. The dental surgeon muttered something about hysterical women seeing things that weren't there but prescribed me antibiotics and more pain meds anyway. And that was how the 1-2 week recovery took an entire month and I ended up having to drop out of a college course due to missing so much. The dental surgeon muttered something about hysterical women. I'm pretty sure this fuckery has caused many deaths. Like many, not a doctor but just screwed over by many. Got an infected hangnail so I went to urgent care. I got a shot of an antibiotic or a prescription for another. Took the pill for about a week out of the 10-day dose. On that 7-day mark I was in my chemistry class, which was at the end of the day, feeling extremely lightheaded, tired, and so dizzy I could barely see. I staggered down the stairs of my HS to see the nurse but she was out to lunch. I didn't know what to do and had bad attendance due to chronic illness so I stayed for the next class. Went home on the bus and passed out on my couch. For the next 2 days I had a bunch of symptoms. I spiked a fever of 104 degrees Fahrenheit. Had a swollen lumpy throat, in and out of consciousness, vomiting, coughing, and dizziness so bad I couldn't stand. Went in the next night after coming home from school with a fever of 104. Urgent care doctor said that wasn't a treatable fever, that I had an upper respiratory virus that was also untreatable, and told me to go home and not worry. I wasn't allergic to the antibiotic I was taking because I was taking it for a week and had no reaction before that day. Next night felt even worse. Couldn't keep food down. Could barely breathe. Dizziness was so bad I couldn't get up to use the bathroom without being in severe danger of falling. There was also a rash that was going from behind my ears down to my stomach and little red blotches. Went to the ER this time. Also had a yeast infection from the med. Doctor there wouldn't touch me. He barely wanted to look at me. He wouldn't do any kind of exam on me besides look at the rash on my stomach. He said it was measles. Gave me nothing for that. Said there was no way I was allergic to the antibiotic. Sent me home. Went the next day to see my primary doc who squeezed me in due to my symptoms. Talked to the assistant getting my vitals and symptoms about what was going on. She said I was allergic to the antibiotic. She wrote in my chart that I wasn't supposed to take it. A nurse practitioner came in and listened to me tale of woe. He said I was having a bad reaction and also wrote again that I should stay away from the antibiotic. He said I could have died and usually would have because it built up in my system and caused a deadly reaction. Doc comes in and says the same thing. If I take it again I'll probably die. Not measles. Not an untreatable upper respiratory virus. My dad has a lesion on his leg that wasn't healing. The dermatologist prescribed different antibiotics, pills and ointment, but nothing was working. He did 2 skin grafts that didn't work. This went on for at least 2 years. Then my dad got a new dermatologist from the same hospital. She realized that he never had a biopsy. It took her less than an hour to diagnose the skin cancer. The surgeon scooped all the cancer out, another skin graft, and that was it for a while. Since then he got a lot of other skin cancer lesions but now he knows what it is. Not a doctor but a patient. When I was in labor with my 4th child the doctor refused to admit me. I wasn't very dilated and have a history of fast labors. I know when I'm in labor because the pain is different. He gave me a sleeping pill to take and told me to go home and sleep. I refused to leave. The doctor was angry and said he'd admit me, but wouldn't give me anything to augment my labor. My son was born 2 hours later. Frick you doctor. Listen to moms, we know our bodies. I had the opposite. I'm a midwife and gave a second opinion. The first was received from the woman's GP. She came into the antenatal clinic and said that she'd had a headache that she couldn't seem to shake. She'd called her GP the day before who had told her to take 2 Panadol and have a bath and that she'd be fine. Whenever any pregnant woman complains of a headache, especially one that won't go away, it sends alarm bells ringing as it can be a symptom of preeclampsia. Sure enough, the woman also reported seeing blue spots, had a blood pressure of 220/180 and a huge amount of protein in her urine. I got her to lie on her side in the room I was seeing her in, and raced to get a more senior midwife. It wouldn't have been more than 60 seconds that the 2 of us returned to the room, just in time to see her start having an eclamptic seizure. We called a code pink, obstetric emergency, which then escalated to a code green, alerting theatre that we were coming down now for an emergency cesarean. and the woman gave birth under general anesthetic 20 minutes later. I still start sweating when I imagine what could have happened if she hadn't come into the clinic that day. OB-GYNs of Reddit. What's the most mind-blowing thing a husband or boyfriend has said? I'm not an OB but work at a L&D hospital. In a note for our patient, there was one from a previous office visit that said chief complaint. Husband concerned about wife's weight gain during pregnancy. She was actually under the weight she needed to be at during that time. My mom was a general practitioner. She once had a 15-year-old girl come in who had a pregnancy test show positive but was adamant she couldn't be pregnant. My mom confirmed the pregnancy but the girl still refused to believe it was true. She went on to explain to my mom it was impossible for her to get pregnant because her boyfriend had told her that if she laid completely still during sex then she wasn't sexually active and couldn't get pregnant. I'm a nurse and helped deliver this girl's first baby. I was still in school at the time. She was like 19 I think. The father, who was obviously much older, was also in the room. After baby was born everyone was all excited and emotional, except for the father, who was just like and shrugged it off. I can understand not wanting kids, but not giving a crap about them once you do have one is mind-boggling to me. Frick absent parents. My mother is an OB-GYN. She did a manual vaginal exam for a woman and the husband asked her, with an angry tone of voice, if there was any other way of doing the exam besides her using her fingers, because he didn't like her putting her fingers in his wife. She should have said that she was doing the exam digitally. Seeing mom back in the office for her 2-week follow-up after delivery to remove stitches. She had a tear that needed repair, only to find out the stitches were gone. Turns out hubby took them out because they were bothering him during sex. This is only the first comment I've read in this thread, and I think I'm already done. Work and I am but a patient's partner not wanting us to reveal an HIV diagnosis to a patient was definitely a low point for me, though where I work it's probably a stretch to even call that surprising. Back in my days, a young teenage patient came in with pregnancy type symptoms. Of course pregnancy test was positive, and appeared utterly shocked she was pregnant. I asked her if she was sexually active. Yes. Do you use condoms? Number. BC. Number. Still she seemed surprised this had happened. You can't get pregnant the first time. My boyfriend loves me and won't get me pregnant. It was just the tip he pulled out. A nurse here had a 19-year-old woman come in for abdominal pain. She had 2 kids and was pregnant again. She said she was not happy to be pregnant again but she didn't want to break up with her boyfriend. I thought the BF may have been abusive or not letting her use birth control or something so I closed the door and asked her some questions. Turned out she didn't know sex caused babies. Her sex ed consisted of get boyfriend married and the babies arrive with no other details. So she thought once you had a boyfriend, babies were automatic and sex was just a fun thing to do. We had a long talk. Crap, that is sad. Not an OB, but when I was in med school I was seeing a pregnant teen who was convinced she couldn't be pregnant. I asked if she was sexually active and she said yes. And I asked if she used any type of contraception and she said no. However, she said that her BF told her he couldn't get her pregnant because he got kicked in the balls a lot. And once more coming up I guess, and the old saying once more with feeling as she landed a kick fair and square. He complimented my surgical ability, stating that he had been to many strip clubs, and he has never seen such a beautiful C-section scar. Not an OB but I work in an ER and we had a 22-year-old woman come in a while back. I asked her what she was here for and she said I found a hole. Like an abscess? I found a hole. Okay, is it a wound? Does it hurt? No, it's just a hole. It's a black hole. I 100% didn't understand what she was talking about and knew that I wouldn't get any more info from her at the check-in desk. So I gave her the bracelet and sent her to the triage nurse, who had the same conversation with her. She couldn't specify anything beyond look. It's just a hole. It was her vagina. Black children are pretty light-skinned when they are born. A maternity nurse told me that some fathers immediately suspect that the mom has been unfaithful when they see a child with a far lighter complexion. Definitely gave a story to the nurse who was taking care of my wife and I after our second. Having been going through labor all day, only being on liquids and not giving birth till almost 9 at night. We were relaxing. Relative term. With the nurse while holding the baby. When I turn to ask the nurse a question, she pauses, turns away, turns back to me and responds back with, "Not anytime soon." Disappointed, I try to push for more specifics, because I had casually asked when can my wife have snacks, and that was a pretty nondescript answer for somebody who hadn't eaten in 12 hours. Turns out, though I was asking when can my wife have sex, after a good laugh the correct answer was a couple of hours. I can't imagine what was going through her head before the clarification. Bless you for looking after her snacks. Not an MD, but when I was a paramedic I was called to a home for a 14-year-old girl who I found standing over the toilet, and I noticed there was what looked like an umbilical cord going into the toilet. Upon further examination I discovered there was a newborn baby in the toilet. The child stated this newborn could not possibly be her baby as she was a virgin. Update. I should have said this before. The baby lived, and after I dropped baby and mom off at the hospital I don't know what happened. This is incredibly sad. Last month, a dad asked one of our OBs for an extra stitch during his wife's repair after delivery. Her immediate response was, "Exactly how small do you need it to be, sir?" Freaking legend on our unit. Now, spread this so it can become the standard response to this all too common statement. Not an OBGYN, but my OBGYN had the sex talk with me instead of my parents. They withdrew me from sex ed classes and made me show up to a counselor instead, promising they would teach sex ed on their own time. Anyway, the OBGYN said that anal sex is legitimate but that you can't get pregnant from it. She had met at least 8 couples in her lifetime. Age was late 40s, early 50s, where the couple was having fertility issues, and it was because the husband was using the wrong hole. I repeat, the husband was using the wrong hole. It was even more mortifying because these were very traditional couples, Asian, Indian, Christian, and they were horrified they were committing sodomy. So yeah, the conversations that woman must have had. I have to wonder how far down the list of questions and tests they get before they need to say, "Point on this photo what part you use, and, on this portion, describe what you do with that part and where you do it." Sister is a nurse in the mom-baby unit who will also work in labor and delivery. One dad asked for a C-section so her vagina wouldn't be ruined, or another dad asking for her to be stitched up extra tight after delivery. Bonus edit. Another dad that couldn't seem to keep his clothes on during their entire stay. The nurses had to have multiple conversations with him to keep his clothes on. He just kept stripping and walking around, like he'd go out to the coffee station in the hall with only his whitey tighties on, and he'd be buck naked in the hospital room. We had to ask him to wear pants and a shirt when in the hall, and at a minimum pants in the hospital room. No, he was not trying to have sex with her. The husband stitch. Hate that it's even a thing. My dad is an OB-GYN. I asked him, he said he was delivering a baby and the father seemed extra nervous, which is to be expected, but my dad sensed something was off. Well, anyway, he delivers it, and as soon as it comes out the father yells, "It's mine, it is white," then ran out of the room and told the family before my dad could say word. Needless to say, my dad did tell him that sometimes black children when born can look white, which led to a big argument and security having to be called. Reminds me of the story where the baby came out a bit dark and the husband went on and did about his wife cheating and had his whole family basically abuse her, only to find out that he was the one cheating and projected his guilt on her. What and but. Not quite what you are asking for, but when my wife was pregnant she fell down the stairs because our other child decided she wanted to jump out of mom's arms. Cue all the bruising and preterm labor. After that, appointments got really awkward. Nurses were short with me. I finally told my wife that I had a feeling the staff didn't like me and I figured I'd sit the next appointment out unless she really wanted me there. My wife said she noticed all of this and decided to ask a nurse what the deal was. Turns out the whole office just assumed I'm the one who pushed her down the stairs. I wasn't even home when it happened. That's when I found out that I apparently look like the type of guy who would push a pregnant woman down the stairs. Kudos to your wife for straight up asking what their deal was so that could be cleared up, lol. I did women's and infant nursing for 10 years. This wasn't the dad but rather the mom. 1 hour before change of shift, we get a cesarean admit. By this facility protocol we used an injectable opiate in her epidural to control pain. A common side effect is itching. Keep this in mind. Also, apologies for the cussing. I am speaking verbatim. Said patient was being wheeled on her bed to her room and the itchies were hitting their peak during this transit. I receive her in the hallway and help wheel her into the room, get her comfortable and start prepping her chart. Not 2 minutes after I exit her room, commotion starts in there. She's screaming. I run in and assess the situation. Immediately she grabs my hand on the bedside and begs for the itch to stop. She's actively sitting up a no post-op so fast and scratching her nethers and her butt. OMG, help. Someone scratch it. The husband finally makes an arrival at this exact moment and says, scratch what honey, big mistake. I've never seen evil before, but this woman bout came unglued. She looked at him and dead to rights screamed, my butt, you dipshit. If you'd have unloaded there we wouldn't be in this mess. Now scratch my butt. We are trained to keep a poker face, but not one person could maintain it. Every single one of us. Family, patient, care tech, etc, except the dad died in giggles. Most of us crying from trying desperately to have a modicum of professionalism. Nope, it was 100% gone. Had to excuse myself to grab the IV Benadryl to send her into non-itchy bliss. Runner up, I'm also a trained lactation consultant. This means I'm an expert in helping new mothers breastfeed. One couple had an order for my assistance due to poor feeding for baby. I go in and meet them both, educate to what's about to happen, etc. This father is uber excited about his firstborn son. Extremely helpful and just bouncy energy. Well, I needed mom to express some milk for baby by hand and began to demonstrate said technique. I kid you not. Dad takes this exact opportunity to jump in and say, do you want me to help? I can get it started going by sucking it out. We do this all the time. Lem help. Cue mom's death glare. This is what I came here for. I worked in a diagnostic center. OB-GYN refers patient for a transvaginal ultrasound to find out why she is having fertility issues. Tech inserts probe. Woman flinches in pain. Tech asks if it hurts during intercourse. The woman explains the husband doesn't insert it in the vagina. No, here while pointing to her belly button. The tech came out red-faced. She had to call the doctor and explain why the patient was having trouble getting pregnant. This happened twice at this clinic. Twice. I think at that point we just kinda let nature take its course and perhaps not educate people on the workings of intercourses to avoid producing more belly button suckers. I know it sounds harsh to rob folks of the pleasures of sex, but dang man, I fear for their children. Dad is a 30+ OB-GYN, now retired. He tells a story of a hyper-religious couple, Muslim, who came in about difficulty getting pregnant. He examined the woman alone and discovered that she was actually a removed accidental slur. Sorry, intersex, male gonads, understanded, no uterus, normal vulva vagina. The woman was mortified to learn this at 18. She feared her husband would be violent, believing he had been being gay by having sex with her. My dad gave her the option to call the police or ask for help. He and the nurses gave her phone numbers for counseling and offered discretion when talking to the spouse. She declined everything and asked that they tell the husband together. The man was super upset, and they eventually left the office both in tears. Dad never saw her again and wonders what happened. Not a physician, but one of the OB-GYN docs I work with told me about a couple who came in for infertility counseling. She was asking them about the length of her cycle, lifestyle, etc and came to find out that they weren't penetrating during intercourse. A fertility specialist told us during his lecture that his favorite was a couple where the woman took birth control the entire time they were trying to conceive. All my friends got pregnant on it, so I thought it might help. Also, there was a couple who had sex up to 80 times a week. Dude was probably shooting blanks at that rate. On my OB rotation, husband said holy crap as the baby ground, wiggled, passed out and hit his head on the bedside table on his way down, and had to be admitted to the same hospital his wife was having the baby at. She ended up getting discharged before he did. I can totally see this. Hysterical. Back in my OB rotation in med school, we had a pregnant woman who was super morbidly obese with a BMI in the 70s. During her first prenatal visit, the resident was asking about her pregnancy history, past difficulty with fertility and conception, problems with the pregnancy so far, etc. Pretty standard stuff as far as I understood at the time. Husband then chimed in about the conception. Turns out they had no trouble conceiving. He then went into detail about how the conception went and blew my little inexperienced mind. Basically, the wife's mother and sister had to help with conception by holding the wife's thighs out of the way enough that he could get in to do the job. I still don't have words. I used to be an L&D nurse. I've heard a similar story from a patient, except in their case it was friends from church. I have friends, but I don't have friends like that. We had a father bring his PS4 to a delivery room so he could play Spider-Man while his wife got induced. Another guy was found to be cheating when his wife was postpartum and went to use his phone to take pics of the baby. Whoops. Not an OBGYN here. My ex-boyfriend was adamantly against me using tampons, cups, discs or anything that had to be inserted. He told me it would change the shape of my vagina. He believed that after a certain amount of time together, my vagina would change to his shape so we would be a perfect fit. That and me using supers or ultra tampons would mean I would need a girthier man. Because, you know, a wad of cotton would stretch me out like crazy. So my question is, does that perfect fit scenario also apply to the 11 other women he was boning on the side? No, just me, or I must be special. Not an OB-GYN but a nurse. And not anything a husband or boyfriend said, but still an interesting story. I once took care of a patient who had a baby as a virgin. She was a very religious woman who was saving her virginity for marriage. She told me she never met the right man and she was ready to have a baby as she was getting older. She was in her early 40s. So she had IVF done and had a baby while also being a virgin. Good for her. She knew what she wanted, and instead of settling in an unhappy marriage, she took matters into her own hands. My dad is a doctor and his friend was a OB-GYN and was telling my dad a time when a couple came into his office and they were having difficulty having a child. They were trying for over a year to have a child but the wife never got pregnant. Found out that the man and the woman came up in very strict upbringing and the man was never putting his penis inside her. He was basically rubbing his penis on top of her vagina and would ejaculate across her belly. Then he would take his finger and smear his semen all over the top of her vagina. My dad's friend had to explain sex to the both of them and tell them what to do and how to do it. Was an awkward conversation. I just kept thinking, did they not ever watch P or have that talk with their parents? Have they never seen stuff related to sex ever? Was just a crazy story. I wonder if they ever figured it out and actually eventually had kids or not. My friend told me that her OBGYN friend told her that apparently a significant number of people try to get pregnant by anal. Proper sex education matters. People. Not the husband. But during my OB rotation the wife asked if her husband could still go down on her. This was a day after a hysterectomy. Her 15-year-old son was also in the room. I was saving this unhair juice for something else, but I think this son needs them more than me. I am no OB-GYN, but I do have a friend that is. One of her more recent crazy comments was a guy who thought that giving birth gave women massive orgasms. He genuinely believed that was how they pushed the baby out, and that it felt great. I wish. Not an OB, but apparently my dad asked my mom's doctor when she was in labor how long it would take me to open my eyes. Like puppies, kittens. I have so many. Dad was busy taking selfies to post on IG that he was having a baby, while his wife was on the other side of the room giving birth. When asked if he wanted to help, he declined and said she got it. Not a OB-GYN, but a med student. In one of my rotations, I had an encounter with a father who wanted us to make her wife only reproducing male child by some drugs or procedure. Our head used to tell us that I can tell the sex of the baby only by seeing the expressions of fathers and relatives in the clinical rounds. You all are allowed to guess my country. India. My doctor told me a story about a baby he delivered. It was the couple's 6th and they were very observant Orthodox Jews, so when she called at 11 PM on Shabbos that labor has started, the husband couldn't drive them to the hospital himself. Although the doctor understood, he tried to help them understand how emergent the situation was. BC the delivery was going to be so fast. The doctor races to the hospital and waits. He waits 30 minutes, an hour. He's pacing the drop-off. Finally, 90 minutes later, a taxi screeches into the parking lot at Pike 2 AM. The doctor opens her door to see the baby crowning and the woman yelling and the driver yelling. The husband throws open his door and just sprints off into the parking lot yelling, does a full loop while the baby is born and runs up as the nurses are wrapping the baby and getting mom and baby into a wheelchair. Doctor, what happened? Where did you go? Dad, I just didn't know what to do. Poor guy was so hopped up on adrenaline he just took off, haha. My mom taught labor and delivery. If the baby won't fit, it's too late for a C-section. You break the baby's shoulder so it can fur through. One of her students asked why they don't break the mom's hip instead. Not an obstetrician, but I used to work in neonates, i.e. the doctor that immediately checks baby over once they are born, makes sure they are breathing etc, and deliveries that haven't gone so smoothly. I'd be there for a lot of C-sections and once had a first time dad who was so excited he was running around and tripping over things and getting shouted at by all the theater staff. Kept trying to take photos of everything, which was cute. But you gotta let me do my thing and make sure baby is healthy and breathing consistently before I'm good to hand him or her over to mum and dad. I just imagined him like a Labrador retriever. Hope you forgive me for the switch around, but when my GF had given birth to our son at home, it was about 8 at night. The two midwives had been there since before dinner time. So when our son was born and we were all talking about how everything went well and our son was cuddling up to my GF in bed, I asked if I should order pizza for us all. I reckoned they were pretty hungry. I sure was. Their dry answer was that was the first time they were ever asked that. And no, they didn't want pizza. So no pizzerino for new dad or Ino either. After labor, I would have given my left arm for fresh pizza delivery. Delivery is a marathon and I was famished afterward. Sorry they were lame. Not a mind-blowing thing that was said, but still kinda funny. When I was in medical school, I did my OB rotation on the high-risk area. Medical students were generally scared of this area, so I was the only student with an awesome attending and got to do a lot. We called the attending on this service a random thought generator. If he thought of something, he would say or act on it. We had one patient that showed up on our service in active labor. She had a very uneventful pregnancy and we couldn't figure out how she was on our service. But, hey, we'll take a normal patient. She arrived with perfect makeup, perfect hair, and she had the perfect epidural and was in no pain or distress. The attending looked at me and said that I'd be doing this delivery. Okay, I thought, no problem. Then he looked at the father and said, "Number, you'll deliver this one." The father got wide-eyed and the mother started laughing. He's an air traffic controller. I've never seen him panic before. The nurse took him to the sink, gave him a scrub brush and had him start washing his hands. We turned back to the mom. Okay, push 1, 2, 3, 10. Relax. We looked at the dad and he's still washing that same finger he started with. Okay, that's good enough. A delivery is by no means sterile. Put this and this on. Our attending didn't put women in stirrups, but would instead deliver straight onto the bed. He sat the dad on the bed with him on one side and me on the other side, and the dad delivered his own healthy child. Not a doctor, but when I was pregnant with my first and only child, my ex-husband was an embarrassment. During the labor and delivery class he was on his phone most of the time, to the point I fell down when I was supposed to be balancing on a ball. When asked how he felt about the baby, he stated, "I'm not making a big deal out of it," shrugged and went back to playing on his phone. The other couples in the class came up to me during the break to ask if I was doing okay, and even the instructor voiced her concern with me privately. I had to have an emergency C-section and he just fell asleep. The nurse woke him up by screaming at him that I was going into the operating room. He didn't want to hold our son. He didn't want to change diapers. He would scream at our 2-day-old son for crying and get mad at me for not getting up and doing anything. The nurses kicked him out and 3 of them gave me names for divorce lawyers, one of which I eventually used. The kicker: my ex begged me for a kid because all he wanted was to be a dad. I was on the fence on having kids. 2 years before my son was born, he told my mom that he was going to divorce me if we didn't have a child. Update: wow, I honestly didn't think this comment would get this much attention. Thank you for the awards and all the nice comments. To answer some questions that I saw. 1. Before my son, he was an okay husband. When we first met he was amazing, but now that I look back, I could see he just wanted a live-in caretaker. Hindsight is always 20/20. He was a bit addicted to video games, but for the most part we got on decently. The video game addiction just got so much worse after my son was born and he began prioritizing them over me and our son. Just one of the many reasons I left. 2. Yes, he still has contact with my son. He pushed for 50/50 custody so he wouldn't have to pay child support, which he got, and neither of us owe child support. Now my son only sees him on weekends, if that. I'm working with a lawyer to get child support from him. 3. My son is great. He started kindergarten last year and is excelling in math and reading. He's been on the honor roll every quarter. He's turning 6 in a few months, and while motherhood is difficult, especially while working full time, I love him more than anything in this world. He's taught me a lot about myself and brought so much joy to my life. I can't wait till it's safe to go to Disneyland again because I'm taking him for a week. He wanted the title of dad but not the responsibilities that comes with it. I'm so sorry this happened to you, but I'm glad you kicked him out of your life. Doctors of Reddit, what's your weirdest case of a patient accurately self-diagnosing? I had a patient who predicted her own death. She was a relatively healthy 90-year-old with hypertension and diabetes. She woke up that morning, told her daughter that she was going to die. She made her daughter go to her lawyer's office and sign a living will, confirming DNR. That evening she had a massive heart attack and was rushed to the ER. We tried medical management, but per her wishes, a living will that she signed like 6 hours earlier, she did not want any invasive measures taken. She died about an hour after she came in. Remember that dude who peed on a pregnancy test kit as a joke and got a positive, and Reddit told him it might have been testicular cancer, and how he visited a doctor and it turned out to be testicular cancer? That's nuts. My dad, who is a great person but also occasionally an butthole, took my 3-year-old sister to the ER with the flu. Thing is, there was a meningitis outbreak in the area, and the ER was packed. Dad, being an butt, tells the nurse he is suspecting meningitis to bump us to the top of the list. The doctor is P, because she has no meningitis symptoms, no stiff neck, no fever. They get into an argument. He orders a spinal tap. Since dad is concerned, dad will not back down at this point, and it comes back positive for meningitis. When I was in 2nd grade I wanted to get out of class, so I complained about feeling sick even though I felt fine. They sent me to the health room. Checked my temperature. Next thing I know I'm in the ER. Had a temp of 103.9 and walking pneumonia. Had a patient who yelled code blue really loud from his room. As we all rushed into his room, his heart stopped. He didn't die that day, fortunately. Not about a doctor but an EMT. When my friend was in college, his appendix burst. He was in extreme pain, couldn't really move, and was acting delirious. His girlfriend called 911 and said she thinks his appendix burst. Ambulance shows up. EMTs think he's just drunk and refuse to take him seriously. They take their time, give lots of attitude, lecture them about drinking underage, all while she is panicking, telling them that he doesn't drink and needs to be at the hospital now. She was right and the EMTs almost killed him. When I had a stroke in college, the doctor gave me a super condescending speech about underage drinking and discharged me. That was after the blood tests came back clean. I ended up having another stroke in the 5 weeks it took anyone to take me seriously. During my 2nd lung collapse, the doctor was adamant that it was just a panic attack. Since it felt exactly like my 1st lung collapse, I kept insisting he take an x-ray. After the x-ray results he said, against all probable odds you were right, and I had a tube in my chest within the hour. A response like that would pee me off. It wasn't against probable odds. You had experienced it before and knew what it felt like. What a jerk. Not a doctor, but the Texas shooter diagnosed himself with a brain tumor and no one believed him, despite him going to multiple doctors and begging to be checked. He literally killed a bunch of people to prove to the doctors there was something wrong with him, and gosh darn it if the autopsy didn't find a giant tumor in his brain pressing on the aggression center. Went to the same emergency room twice explaining that something was fricked up in my head. They diagnosed me with anxiety attacks both times. Had stroke 2 days later. So some backstory, not a doctor, but really who is in this thread. In 6th grade my best friend had his appendix burst in the middle of the night. After hearing about it, I was utterly terrified of it happening to me. My parents and doctors all told me it is relatively rare and if it did happen there isn't really anything to worry about. I asked what it felt like if it did happen and they said, oh, you'll know, yay thanks. Really helpful. But my appendix bursting became somewhat of a phobia of mine for over a decade. Every time I felt abdominal pain or severe gas I always jumped to the conclusion of appendicitis. So about 10 years later I am hanging out with my friends when I start to feel some bad gas pressure coming on. Nothing too bad, but nothing would really make it go away. After I got home it was still rather bad, but I figured I'd just sleep it off. Woke up at about 5 AM curled into a ball throwing up on my pillow. At this point, I was still living at home with my parents, so I hobbled my way to their room and woke them, telling them I think my appendix was going. They told me it's probably gas, and are you really sure we should take you to the ER? I told them I was sure it was my appendix and they sort of told me to wait it out until 7 when they could phone the family doctor. So I curled into a ball in the bathroom and threw up for a few hours. At 7 on the nose they called the doctor and I described my symptoms, and the doc told my parents to take me to the ER now. So we get to the hospital, and I am walking so hunched over my face is almost at my knees. Bring me into the ER and they order a CT scan. Think it was a CT, was kinda out of it, and put me on some killer anti-nausea pain meds. The endoscopic surgeon comes in with my CT scan and tells me, verbatim, this is the most clear-cut case of appendicitis I have ever seen, and asks me to sign a release, because he was going to film the operation, endoscopic bits at least, for training materials. So long story short, I had appendicitis. I knew it, and it was so clearly appendicitis that the doctor wanted to film it to teach other surgeons. So for any aspiring endoscopic surgeons in the thread, maybe you get to see inside me. Not a doctor, but a chronic patient. I have a rare neurological disease that causes tumors to grow on the nervous systems, and on any other type of body tissue, but the nervous system tumors are most common. I was diagnosed at age 4. I've been treated by the same clinic for over 25 years, having seen the same specialist for 20 of those years. The hospital where I'm treated is more than 3 hours away, but my local hospital is affiliated with them. I woke one morning with severe hip pain, swelling in my thigh, and a terrible limp. I went to my small town where I was told I had a skin infection. Doctor just visually examined me, ran no tests and told me it was razor burn from shaving my bikini area, was giving an antibiotic. My disease is in my medical records, which the hospital had access to since it's the same medical facility, just different locations. 2 days later, the entire inside of my thigh had turned purple and blue. I couldn't walk without excruciating pain. I went to an express care, like a step down from the ER. They immediately sent me to the ER for symptoms of a blood clot. The on-call doctor notified the ER I was coming, demanding an ultrasound. I arrived back at the ER, where the ER doctor basically told me she wasn't ordering an ultrasound because it wouldn't find anything, was told the bruising was self-induced to get pain pills, and that I was being discharged and blacklisted. My husband flipped crap and demanded an ultrasound, threatening legal action if not. Dumb doctor gave me attitude but eventually ordered the scan. The ultrasound tech turned white as a ghost, quickly turned off the monitor and rushed to get the doctor. It turns out I had a tumor the size of a 12-ounce soda can growing off a major nerve in my groin. I somehow strained the muscles around it, damaging my nerve and muscle. Never got an apology or admission of being wrong from the doctor. My specialist later told me she had a lot of fun talking with the doctor with heavy sarcasm. It's sad that your husband needs to threaten legal action for you to be taken seriously. Dang. Not a doctor, but a patient. I woke up one morning with a severe pain in my side and I instantly knew I had a kidney stone. I'd passed one before. I'm a female BTW. Couldn't get into my regular doctor, so I made an appointment with the first guy who was available to hopefully get pain meds to make passing it a little more bearable. I go in to see him, and he is hands down the most arrogant and condescending doctor I've ever seen. When I try to explain to him that I know it's a stone, he tells me that since I was able to walk into the office, I don't have a stone. If you had a kidney stone, you wouldn't be able to move past the stone 2 days later without medication. What an butthole. Not a doctor. I self-diagnosed rhabdomyolysis. Had the whole Coca-Cola colored pee thing. And went in and explained to him that I thought I had it. Couldn't pronounce it. Wrote it down and showed him. Doc kinda laughed a little. Said, man, this internet thing is not doing anyone any favors. This was in 2005. He says, pee in this cup so I can prove to you that you don't have it. I pee in said cup. He takes a look. Says, wow, I don't even need to check this under a scope. I need you to go there right now. Don't go home. Someone can bring you stuff later. Go there right now. I am calling them. They will admit you as soon as you show up. Sure enough. Spent 3-4 days in the hospital with constant full open IV drip, having to measure all my output until some level. Creatinine. Got back into normal levels. Apparently mine was like 1000x higher than it should be. How did I get this horrible thing, you may ask? I went to a gym. Told the guy I have never really worked out before, but I am getting older and need to get in shape. Turns out, when you are a younger athlete and stop working out, you might still be able to go at it harder than your body can handle, and you break down way too much muscle fiber and end up clogging your kidneys. Yay. I love this one. Mayan, nothing wrong with no weight, you're very close to death. My B. Sorry, I'm not a doctor, but last year when my daughter was 3 months old she stopped eating and pooping. Then she started getting weak and limp and it got to a point where she couldn't even open and close her mouth and eyes. A doc said she was dehydrated and put her on an IV overnight. The next morning, she was worse. How are you worse but not dead yet? IDK. Anyway, I read a NIT article that was meant to be a riddle for medical professionals, and the riddle described my baby to a T. Most of the commenters guessed infant botulism, so I suggested it to the pediatrician that came in the next day. He said no, she's probably still dehydrated. That immediately made no sense, and she'll be fine. We can go home. Mind you, we live in NJ and this was in NC. We were on the way back home from a road trip to FL. I wasn't having it. We asked to transfer to a children's hospital. The docs there did every test they could think of, and nothing was coming up. I begged them to test for IB, and gave them full permission to laugh at my lack of medical expertise, and since they already tried everything else, they obliged. It was IB, the first case that hospital had seen in 20 years I think. The residents on her case wrote a paper about her. Had a patty entered the ICU on a ventilator because of rapid lung fibrosis. Usually it's triggered by medication or an outside trigger. Pets, feces of pets etc. We stopped one of his cardiac medications which is known for being able to cause this kind of syndrome, and the progression of his disease stopped. We told his wife and she said, yeah, I knew, and I knew it was this particular drug. The dog told me. We were shocked and asked her to explain. She told she had been feeding the different drugs of her husband to the dog over a period of 2 weeks. Every day a different drug, and he had started barking when she fed him this particular drug. She had been feeding the different drugs of her husband to the dog. I hope people don't actually do this. For 16 years I complained about severe pain, loss of blood, listlessness, and extensively long periods. We're talking 13-17 days. I kept getting told that it's normal. I'm exaggerating. It can't be that bad. I must have a low pain tolerance etc. I tried every single form of birth control over those 16 years. In 2008 I had exploratory surgery since my gyn couldn't figure out what was wrong. Turns out that I had severe ovarian torsion, which they repaired, and they also found quite a bit of endometriosis and removed it. I still had heavy long periods, but the pain wasn't as bad. Then the pain started coming back in 2015. After several trips I finally get an appointment with a new gyn. I said I was tired of this crap and wanted a hysterectomy. She said before doing something so drastic, she suggested trying an IUD. So, I did the Myarino IUD for a year, and got such bad depression from it I wanted to kill myself, on top of horrid pain anytime I had sex, and with months of constant bleeding. Then this past June, my gyn agreed to do a hysterectomy. I was full of endometriosis, adhesions, and cysts. I was having bladder incontinence problems because my bladder was completely surrounded by the endometriosis. Now I am 3 months post-op, and so glad to be free from all the pain and bleeding. Plus the bonus of never having to worry about an unwanted pregnancy. That's horrible. I'm glad you're finally in a good place. I was 9 when I fell off of my bike on a family bike ride. I was screaming like crazy. Say my leg was broke. My parents thought I was crying wolf and told me to walk it off. When I wouldn't shut up, my dad carried me to the parking lot while my mom got the car. I remember my dad telling me to put my leg in a position if I truly thought it was broken, but he was still skeptical. Lo and behold, when we went to the ER to get an MRI, my leg had a spiral fracture. Not a doctor, but I started having painful abdominal spasms and I was sure it was my appendix. I have a very high pain tolerance, so for 2 days I was still carrying my heavy toddler and working out. I told my husband and family and they wouldn't believe me and told me it was just gas. But I knew something was wrong. Anyways, I decided to go to the hospital despite my husband's protests. I was making a big deal. The doctor didn't believe me. They sent me for a vaginal ultrasound because she thought it was probably an ovarian cyst. I was pissed they weren't believing me, so I let them give me the ultrasound anyways. Came back negative and they were about to send me home. Decided to make my husband drive me to another hospital. Everyone was pissed I was making them waste their time since my husband had to miss work and my mom had to watch our son. Anyways, turns out I had appendicitis and my appendix was about to burst. Doctor said if I would have waited a few more hours it would have burst. Had surgery within an hour of showing up. I was pissed at everyone that didn't believe me. Haha. So I fell out of the top bunk on vacation and broke my leg on the lower metal frame. A doctor said I couldn't possibly have broken it and I was just trying to score pain meds. His proof, I walked in. 4-hour car ride back home. My regular doctor puts me in his own car to drive me to the hospital, where the swelling on my leg is now too much to cast. Originally, doctor paid all my medical bills and was reviewed by the state board, where it was discovered he had been drinking on the job. Lesson 1. You can walk on a broken leg. Lesson 2. Don't be a dong. Not a doctor. I had gallbladder problems some years back and went to the doctor. He said my blood work came back normal and that it was probably either indigestion or a strained muscle. I told him I knew it wasn't. He asked me what I thought it was, so I told him I was certain it was my gallbladder and that it was full of stones. He told me verbatim, "You're not middle-aged, nor overweight, so it can't be that at all." I told him rather sternly to order the ultrasound because I was very certain he was wrong about what he thought it was. Half hour later I'm laying there getting the ultrasound done when the tech was all yay, so I'm not supposed to tell you anything but I'm going to anyways. That is a fat sack of stones. I've never seen a gallbladder this bad before. My gallbladder was full of large and small stones. I cried and thanked him, then cried more because I was so angry with the doctor and the nurse practitioner and the previous nurse practitioner I saw a few months before that appointment for the same pain, who wrote it off as a strained muscle in my back. After the doctor saw the ultrasound, he came in with the nurse practitioner and 3 other nursing students to tell me I was right and to give them a lesson on listening to patients and to not just brush off their concerns and suggestions. Almost 2 weeks later I was in for surgery. Good grief, this turned out longer than I expected. Good on that doctor for acknowledging his near fuck up. Picked up a long-term patient at county hospital who was both epileptic and schizophrenic, and she told me her history with incredible insights and understanding. The reason she was there was because she was on Dilantin and meds for her schizophrenia. So she said, "This is what happens. I'm taking all my meds, but I begin to cut back a bit on the stelazine for schizophrenia. Then I get a bit more paranoid and figure I'm being poisoned with the Dilantin. So I cut back on that and have a seizure. That cures my paranoia for a while and start taking my Dilantin and stelazine again. But then I get paranoid and stop taking as much of the one or the other. Then get more paranoid, stop my Dilantin, get a seizure and end up in here." She knew exactly what was going on. Incredible insight, and her records showed she was right. Incredible insight into what was happening, but completely powerless to stop it, either. The seizures made her sane a while, and things would balance out, and finally a few times a year she'd end up in hospital because it would get out of control. As a psychiatry resident, I love ACT for this reason on my psychotic patients. It's so neat and it works so well. Interesting to hear about schizophrenia patients with insight. It's unfortunately not as common as I would like having a patient agree with my assessment that they're suffering from psychosis. Not a doctor, but this happened to me. When I was 8, I was having severe headaches. Like it felt like someone was constantly stabbing me in the eye. My mom, who is an LNA, suspected it was nothing more than a sinus infection. She took me to the doctor to get checked out and get put on antibiotics, but they were adamant that it was not a sinus infection. They claimed I was too young to get one of those. For the next 2 weeks, I was in the hospital every day where they were running all sorts of tests trying to figure out what was wrong with me. They checked out my eyes, checked my urine and blood, but couldn't find anything. The whole while still had severe headaches that were progressively getting worse. Finally, they suspected that I potentially could have a brain tumor. This scared the daylights out of me and my family, as my grandfather died of a brain tumor before I was born. They ran a CAT scan to check, but they failed to find a tumor. What they did find out, however, was that my sinuses were severely inflamed, and I had a horrible case of sinusitis that needed antibiotics to treat. Once in antibiotics, I felt better within 5 days. After that, we started going to a different doctor. Too young for a sinus infection at 8. LOL. Wow. That's so insanely ridiculous. They thought that wasn't a possibility. I had my first sinus surgery at 8 because I had chronic sinus infections and headaches for years. I then had another at 10, and last year I had one more at 27. I'm glad yours wasn't something worse at least. I'm no doctor, but this is something that happened to me. Earlier this year I got sick. Seemed like the flu and felt absolutely horrible. Once I got healthy again, I started getting bruises for no reason and would get really easily winded just from brief exercise. I'm pretty in shape, so this was odd to me and needless to say concerning. Of course I googled what I was feeling and WebMD was telling me I have cancer or a blood problem. Of course, I ended up seeing 4 different doctors who all told me that I'm paranoid and just need to relax, but I couldn't shake that I felt something was wrong. Finally, the 5th doctor I saw said she'd give me a blood test to calm my nerves, and the next morning I get a phone call in my dorm room saying that there's a bunch of things wrong and that I need to go to the hospital. When I asked what that could mean, they told me I could have leukemia. Needless to say, the scariest moment of my life, as I'm only 20. Long story short, months of doctor's visits and eventually a bone marrow biopsy revealed I don't have cancer, but a rare blood disorder called aplastic anemia, which causes your bone marrow to stop making cells. I'm happy to say after extensive treatment I'm doing well now, but it's very freaky to me that it took 5 different doctor's visits to finally hear me out when I said I felt something is wrong. I understand that these doctors probably deal with whiny people who exaggerate everything, but you can't get complacent when people's lives are on the line. Something should have immediately started ringing bells if you mentioned that you were getting winded with little exercise and bruising easily. Jesus Christ. Not a doctor. Every time my wife had a little discomfort in her belly, she'd worry that it was ovarian cancer. She'd tell me that her worst nightmare was dying of ovarian cancer and leaving me with 2 young kids. And every time I'd tell her she was being silly and morbid, to try to comfort her so we could both go to sleep. Years go by and she starts getting real pain. Turns out her gallbladder is swollen and they remove it. So I tell her, see, it was your gallbladder all this time, but the pain doesn't go away. The doctors tell her it's from the surgery, but it gets worse. Eventually she gets an MRI and it's ovarian cancer. 3.5 years of struggle later and she dies at 50 of ovarian cancer. I kick myself for not taking her fears seriously and doing what could have found the cancer years sooner and possibly saved her life. She never worried about breast cancer or cervical cancer. It was always ovarian. I think that maybe your body tells you things and it shows up in fears and dreams and who knows how else. But maybe we should listen more carefully. I'm so sorry. That's awful. Hope you and your kids are doing okay. Not the doctor, but the patient. I went to the ER with excruciating pain that I knew was kidney stones. I was vomiting and unable to move without help because it was so immobilizing. Doctor wouldn't listen and kept trying to insist that it was just a pulled muscle in my back. My mom, a nurse of 30 years, demanded an ultrasound as so far they had done no testing but palpating the area. He was stubborn and absolutely did not want to waste time. She threatened to report him for negligent patient care. I was literally puking into a basin as they stood on either side of my bed arguing. He finally caved and reluctantly sent me to get the ultrasound done. Wouldn't you know it, A stone was completely blocking my left ureter, causing a fluid buildup in my kidney, which in turn caused my kidney to swell up. They were able to get the stone out and get the swelling under control, but the doc refused to look my mother in the eye or acknowledge her after she proved him wrong. Good on your mom for advocating for you. She sounds like a great mom and a fantastic nurse. That doc sounds like one of those guys who's dismissive of nurses when they're the ones who are with the patient the most and can give the most accurate info for someone in their care. Wasn't my own diagnosis, but I went in with my mom when I was 11 and my mom told them I had appendicitis. They were super reluctant to even look at that possibility and assumed the CAT scan was showing them built up gas. My mom insisted they keep going, so they sent the scan to another city for them to examine, and the docs came back in to tell me that my appendix had erupted and that gas all over my abdomen was toxic pus. If I had been sent home, it would have been a death sentence since it was already approximately 2 days since it popped. Also not a doctor, but it happened to me. Went to the doctor because I found a little hard spot on my testicle. It felt like a little hard seed on the side of one testicle. Definitely something new and weird, and it got me concerned. I go to the urologist and tell him I have something weird on the side my testicle. He's confident I'm just feeling my epididymis, and I'm an idiot. He just keeps giving me biology lessons on what's inside a testicle. I tell him no, I know what you're talking about. This is not it. It's hard to find it and feel it. And having a doctor twiddling my testicles between his finger and his thumb was not really getting anywhere. He suggests an ultrasound. I go to get the ultrasound. The technician asks what I've been feeling. I explain. She is also convinced I'm just feeling my epididymis. Here we go again. I explain. She scans my balls. I go home. Doctor calls later that week. They found a calcification outside my testicle and that's what I felt. But also it was no big deal and only to worry if it grew. Yeah, so it wasn't my freaking epididymis? A lot of people got to see your balls. Surgeons of Reddit, what was your oh crap moment? I was doing a corneal transplant when I had the oh crap moment. During surgery, I cut off the patient's own cornea and replaced it with a new donor cornea. During that moment when the host cornea was off but before I could get the new one on, there's literally nothing on the front of the eye except a tear film and aqueous humor. Anyway, the patient takes that moment to start vomiting. The reason we tell everyone to skip food and drink is so they don't aspirate in case they throw up. This patient lied about eating breakfast and started throwing up everything. The eye's still open sky at this time. Everything inside of the eye can now become outside of the eye, and she's bucking and vomiting. Those not in the know will say this is not good. Those really in the know will say oh crap. Anyway, I had to grab the new cornea and start stitching as fast as I could on a patient actively throwing up. I used 10-0 nylon sutures which are thinner than an eyelash. It turned out okay but not great. Don't lie about eating breakfast before surgery, folks. Doing a C-section for this poor mum who'd been in labor for hours. Baby wouldn't come out of the hole we'd made, so more pressure was applied to the fundus, top of the uterus, and suddenly whoosh, baby zooms out like a torpedo, covered in lubricating vernix, zips over the surgical sheeting which is the texture of a slip and slide and almost rockets straight off the table. The baby's foot was caught by the reg who whipped her up in the air upside down like in old cartoons, but almost dropped her again due to gloves and vernix. Thankfully the midwife was ready with the towel and caught the baby to wrap her up. Mum and dad seemed to think this was normal practice and didn't notice, but me and my colleague just stared at each other with a look of absolute horror. It still makes me shudder to think how close the baby was to hitting the floor head first. Never happened before or since. Doctors were very accommodating and even had a baby juggling routine to put new mothers at ease. 5 stars. Would give birth again. When I was a new RN working the ICU in a large teaching hospital, I came into work one morning to a patient that was admitted that night, intubated, breathing tube in, sedated, Foley catheter, tube in PP hole, and all. Long story short, he was extubated, breathing tube out, that same shift and was completely alert and oriented. He was an end-stage renal patient, meaning his kidneys didn't work and he needed dialysis, and was only in his late 30s. Said he never made urine anymore and didn't need the Foley catheter, so he wanted it out because it was hurting. Now the catheter bag had been empty my whole shift, which is normal seeing as how he didn't make urine anymore. And this hospital had a nurse driven Foley removal policy, meaning while we needed a doctor's order to insert one, we could remove one at our discretion, unless a doctor specifically put in orders not to. This patient had no such doctor order, so I went to remove the catheter. They are held in the bladder by a balloon on the end that is inflated with 10 milliliters of saline. I'd inflated the balloon removing 10 milliliters of saline, and pulled it out. As soon as the catheter left his penis, blood started pouring out in a heavy stream. Turns out the nurse who placed it on admission hadn't advanced it far enough since there was no urine production to indicate correct placement and had inflated the balloon while still in his urethra, causing trauma. It would not stop bleeding. I had to hold this man's penis shut to put pressure on it while my co-worker paged the resident, who came and looked at me with pity as he told me to just keep holding this 30-something-year-old man's penis in my hands to staunch the blood flow until urology could get there to assess. It just kept gushing blood every time I used up to check. For over an hour total I held this man's penis and tried to make polite conversation until the urologist arrived. Not a surgeon, but was working in obstetric theatre in UK mid-heatwave last year. This is important as maternity wards are kept quite warm as newborn babies aren't good at regulating their temperatures. Combine this with a heatwave and the fact that in Britain we're not exactly used to high temperatures and we have the perfect storm. Mid-emergency Caesarean, the scrub nurse assisting the op starts feeling faint. This is unusual as this scrub nurse worked in these theatres full time, so this was her bread and butter. So I can only conclude it was the heat. She has to step out, so the show takes her place assisting the obs registrar with the section. This show looked extremely junior, as in first section ever, and they were trying to assist with the instruments in the uterus when they fainted. I had to jump in and grab the back of their theatre gown to stop them face-planting the open uterus, and then sort of gently tug backwards to let them fall into me when someone else has taken over assisting. This show was not exactly small. Thank God the baby was already out. When I was younger, I had a rather complex external fixator cage applied to my leg. It had 3 rings. 2 large 360-degree rings around my leg, one in the upper middle of the shin, one in the lower 0, which had humongous rods to keep the cage fixed to my leg, and a third one, which was a horseshoe type ring around my ankle, which threaded all sorts of pins through my ankle, each pin set in a certain way. The point of this external fixator was to relocate and fix the positioning of my ankle, so it wouldn't be so fricked. Basically, I have had a birth defect called talipes. Clubfoot, equines. A lot of bone got removed before the fixator was put on, so this way it could all grow. It was a 9-hour surgery, and my doctor, who I won't name, was pretty chuffed with himself after seeing it all installed on my leg. This was until he looked closer. The pins I spoke about before, with the numbers on them almost like those sizing things on cheap Cothangers, were all colored and numbered, set for my dad to do every morning and night. He was looking at the pins and the numbers. He looked, glanced away and looked back with a stressed face on. After a few seconds and a slight hand on head gesture, he whispered crap. In his mind, he had organized the pins in an incorrect way. He was stressed beyond his mind for a few minutes. He was worried he fricked everything up. Luckily he hadn't. He just needed to move 1 or 2 numbers. 1 year later, 8 months after the frame was taken off, which was in for 6 months, I ended up having my leg amputated. The surgery didn't work how we wanted it to, or at least how I wanted it to, which we were sort of expecting. The goal was to get me walking. The amputation got me running. Bear in mind, the amputation was my call. I was 12 when it was done. Best decision I ever made. I had a college prof with leg issues. He finally got them both amputated in his 50s, I believe. He's so happy now. I'm glad you got it done. I'm glad you can run. 5th year resident here. There are lots of bad oh crap moments throughout training, such necrotizing soft tissue infections or takebacks for bad complications or deaths during cases. However, I'd like to share a recent positive oh crap moment. 15 centimeters kidney tumor with thrombus into the vena cava. Big incision. Great exposure of the vasculature in the tumor. My attending and I are dancing around the aorta and vena cava. We are able to feel the tumor thrombus in the IVC. I was expecting that we'd need to cut and clamp the vena cava to get all the cancer out, but my attending literally squeezes the tumor out of the vena cava back into the renal vein, and then has me tie the renal vein off so the tumor doesn't slip back into the vena cava. Patient went home in like 4 days, margins were negative, and is still doing great. First time I felt like oh crap, I'm a surgeon. Surgeon here. I've dealt with loads of morbid stuff, but one thing that made me stop and go oh crap was a conversation with a young patient who had a perforated colon from diverticular disease, which is a common wear and tear of the colon. He was one of youngest patients I had seen with this condition, and certainly the youngest with a perforation so bad as to require an operation. When I was counseling him on the operation, which involves removing the perforated part of the colon and giving him a colostomy, he told me his biggest concern was how he was going to have anal sex with his same-sex partner. He would only have a small stump of rectum left inside, which would be at risk of perforation with any force applied to it. It made me really think about the implications of the surgery we do. The operation is the easy part. I was the patient. I had a liver transplant and was having an ERC done to place a new bile duct stent. Well, apparently my anatomy is different than normal, and my lungs go more down my sides, so he accidentally caused a nick, which caused a hemothorax. So when I woke up I couldn't breathe. They did an x-ray and had to do a chest tube. Eventually I was so exhausted I asked to be vented, so he vented me. Apparently he cried, he felt so bad about it all. But it wasn't him being malicious or negligent, it was simply an accident. Sometimes things happen. You can be the best in the world and still make a mistake. Not a surgeon. Thought I'd share this though. Husband went in for a routine colonoscopy, and as they were prepping him, anesthetist asks him if he's a ginger. My husband tells him yeah. When he was a kid growing up, he had fire engine red hair, though it's faded to a more strawberry blonde now. The anesthetist laughs and says, "Okay, I gotcha. We'll give you the redhead dosage," and winks. Well, my husband thinks it's a funny, until he wakes up at the tail end of the procedure, pun intended, and doctors are just chatting it up and what have you. Turns out it's not a joke, and redheads have some type of natural block to anesthesia. Dude had given him max allowable dosage and he still woke up. Happened a couple years later. They gave him ketamine and some other crap to knock him out to get wisdom teeth out when he told dentist about the colonoscopy thing. He still woke up at the end of that one too. The red hair is a mutation. The location of the mutation also impacts the opioid receptor gene. Happened at my hospital. A mentally ill young woman, who was pregnant at the time, was in denial, locked herself into her room when she realized the contractions were coming. She basically didn't push and the baby didn't come naturally. Her family called 911 because of the smell. They realized her baby had died inside her and was basically rotting due to the smell. She was taken to the OR to remove the baby, and apparently all the nurses and surgeons were vomiting because once they opened her up the smell was overpowering and it was traumatizing to see a rotting baby. Heard an oh crap moment as a patient on the operating table. A couple of years ago I was in labor for 28 hours, pushing for 6, when my child started showing signs of distress. He had slightly elevated heart rate and I had the makings of a fever. My midwife at the hospital told me the doctor was coming in to check to see if a vacuum assist could help. She checks me and immediately stands up with blood on her hand and says, "We're going to the OR now." At that time, I started feeling that zoomed out tunnel vision I know for me is shock. I had anxiety, but figured she knew what was best. She did. We got in the OR 8 minutes later, and when they opened me up, I heard the surgeon say, "Oh crap. Look at this." They say blood in my catheter bag, and upon fully opening me up found my son was actually trying to come through my uterus. He had ruptured it. They got my son out. Those moments where he was stunned and not crying were an eternity. He cried and he was born a completely healthy baby. After I woke up and was back in my room, the doctor came in and told me what happened. I knew a ruptured uterus sounded bad, but oh dang, I googled and started having a massive anxiety attack. A ruptured uterus is extremely rare and so very dangerous and often fatal. I read from the time it happens you have about 15 minutes before you bleed out and baby is dead. When I went back for my post-section follow-up, my midwife let me know as a practice that's been around 35 years with over 30 midwives and doctors, they had never once encountered that, and it was such a big deal for them. A few days after my birth, they all got together to discuss my case. I was so incredibly fortunate I chose to labor in hospital that the doctor just knew from my vitals and babies that something was off. They just didn't know until they got me open. I can't even tell you how grateful I am for Dr. S. You saved my life and my son's life, and our family will forever be grateful. Not me, but my uncle. He is a respirologist and was supervising sitting in on lung surgery to remove a tumor. Turns out the tumor was a root ball. Some type of seed had gotten into the patient's lungs and started to grow. Dang watermelons. When I was in pharmacy school, I was doing my internal medicine rotation in my final year. My preceptor and I were doing med reviews in the ICU when one of the pulmonary docs was basically like, hey, you wanna see something cool? They were trying to extract a foreign object from a guy's lung in one of the rooms. So we go in and watch for a bit. About 6 people in the room. Tube down the guy's throat. Little grippers at the end. 2 doctors watching a monitor and trying to control the grabbers and get it like a claw game. I watched for a bit, then after a while I lost interest and went back out to what I was doing. A few minutes later I hear, "Got it," cheers from the room. Oh, it's a tooth. Dude aspirated his own molar. Doctor walks out with his trophy in a jar and it's a completely intact tooth, root and all. As the patient, I hope if the oral surgeon is on Reddit they posted this story. Wisdom teeth removal. All 4 impacted. Gotta break out the heavy hardware. I'm knocked out. Don't even know the dentist entered the room. I wake up, but not able to move. Just eyes open awake, but my limbs won't react to my brain. I can feel the dentist hammering a chisel into my tooth to break it for extraction. My jaw is just coming undone on every hit. My eyes are wide open. Jaw even wider with some evil metal contraption. I'm staring at the assistant begging for her to see me, and after about a dozen hammers to my jaw she glances over and drops the suction. Jumps up and shrieks. The dentist stops to look at her, then looks at me and I see him say, "Oh crap." Next thing I know I'm waking up post-surgery. Crap that nightmares are made of. I woke up during my wisdom teeth removal. During the lower right one I woke up and could feel the drill. Dentist noticed and knocked me out again. Just an RN here. I was working in the ER and had a patient brought in by her husband. Apparently the woman had a fall a week prior and injured her face but refused medical care. Her husband finally forced her to come in. As soon as I see the wound on her face, from across the room, I think, that does not look like any wound I've seen. I approached her and realized maggots had infested the wound and were eating the rotting skin. A really simple and quick fix, but I can't imagine her living conditions. I choose to imagine the wound was cleaned out of wild maggots and then sterile medical grade maggots were used to clean up the dead flesh. Isn't really the right word there. 8 years after finishing medical school and deferring student loans through residency and fellowship and realizing that I was closer to 40 than 30 with over $200,000 of debt. Capital F. I had an ingrown toenail. It was supposed to be a quick fix. I was 14 and had my mom with me. They let an apprentice do the surgery and he goes, "Oh crap." The doctor in charge just laughed and said, "No risk, no fun." Turns out they fricked up my toe and I had to have 4 more surgeries to correct it. I cried. The doctor really said, "Don't sweat it. They're not gonna sue Mayo. Hope you're okay now, though." I'm not a surgeon, but when I was in med school there was an oh crap moment for everyone, including the surgeons, anesthetists, nurses and students. They were prepping a patient for surgery and put him under and the nurse said, "Okay, he's out," before they were about to start slicing him open. The patient just had enough strength to move his head from side to side and said, "No, I'm not out yet." Everyone laughed it off, but if the patient didn't do that it could have ended badly. This is one of my worst fears. Not being out, just immobilized and undergoing surgery due to a bad anesthesiologist. Not even sure if that could really happen, but I don't like thinking about it. I'm a scrub nurse, doing a lap nephrectomy. Urologist mistook the abdominal aorta for the renal artery, placed the staple gun on the aorta, did not wait the recommended 30 seconds before slicing, cut the abdominal aorta clean in half. Patient immediately crashes. Activate massive transfusion protocol. Patient was, somehow, alive when they went up to ICU. Definitely an oh crap moment. I work in cardiovascular and I can't think of a couple. On my 8 years career I've had 3 patients start moving their arms in the middle open heart surgery. One of them even tried to sit up. The surgeon was literally pushing the patient's shoulders down and yelling to anesthesia to give the patient something. Another time a simple pericardial window. For different reasons sometimes patients can have extra fluid buildup in the pericardial sac that surrounds the heart. The surgeon made a small hole and stuck the sucker in to suction the fluid out and make room for the heart. He stuck the sucker in too far and stuck it through the ventricle. Blood shot out of the small hole just below the sternum. He had to quick open up the patient more under the ribs so he could stick his hand in to plug the hole with his finger. We had to call another surgeon in to help quick crash onto the heart-lung machine. My grandfather told a story about a clamp coming off an artery while he was pulling a kidney in rural Wyoming in the early 50s. The abdominal cavity was quickly filling with blood and the nurse fainted. He was able to push down with his elbow on the descending aorta and got the clamp back on. Patient lived, but I think he chose his surgical assistants little more carefully after that. When I was a surgery intern, I was pulled from doing scut work to help out in a shit show of a case. One of our professor emeritus in surgery was doing a simple liver biopsy on a patient and nicked her hepatic artery. The biopsy was for a recurrent tumor and the patient has been on chemoradiation. What all that basically means is that patient has a hole in a major artery and her tissue has the consistency of toilet paper. Every time they tried suturing the hole, the tissue just breaks apart, leaving a bigger, more leaky hole. Pretty much all hands were on board. The chief residents were scrubbed in, the seniors were literally squeezing blood bags into the patient's veins, and us interns were runners, going back and forth from mortar blood bank to transport blood and plasma. We ended up transfusing over 40 units 12 liters of blood, so the patient lost over 2 times her total blood volume during that surgery. A vascular surgeon eventually swooped in and did a rather slick patchwork that fixed the problem. Even better, the patient was like a daughter to the surgeon. He literally saved this patient's life several times already, and they got really close over the years. She even named one of their kid after him. The poor guy broke down a few times during the surgery and was convinced that he had just killed his daughter. The chief residence had to take over a few times when he was mentally not there. That was his last surgery. He retired the next day. Heck of a way to end a surgical career. Honorable. During my 3rd year of medical school I was stitching up the wound after breast cancer surgery and the anesthesiology nurse woke the patient too early as I was making my last stick and I felt the patient moving her arm and trying to sit up. Patient was still covered in surgery draping and cables and still intubated. Luckily most people do not remember much from the first moments after waking up, but I got quite nervous from the patient starting to move. And admittedly so, I would imagine that would have been terrifying. Not a surgeon, but when I was in nursing school I was observing a tonsillectomy when the power went out. Everything switched over to the backup generators except for the suction, which is incredibly important for any surgery but particularly in the throat. Aspiration risk. They ended up having to connect a giant syringe to a length of suction tubing to suction manually while someone went to the other side of the building to find portable suction. Luckily ours was the only theater that had started operating that morning. I am terrified of complications due to tonsillectomies. I had to ligate a carotid artery of a 14-year-old because he wouldn't stop bleeding from a botched tonsillectomy. I hate face and neck vessels. The B bleed like there is no tomorrow. Sorry in advance for this being so long. Not a surgeon, but my mom had to have a kidney removed due to her waiting for almost 2 years to go to the doctor about her pain in her back. The doctors found out it was a large kidney stone and that her kidney was infected and had lots of gross pus shutting it down. After draining the fluids through tubes, over the course of a month and a half, she was finally ready for surgery. Cue last Wednesday, the day of the surgery. She was ready to finally be done with it. They removed the stent put in and the tubes no problem. Next was the kidney. Here comes the oh crap moment. As they get ready to remove the kidney, there was complications. The kidney's infection had spread to a portion of her lung and a major artery, making them fragile as toilet paper. As the surgeon removed the kidney, a hole was torn in the lung. And even worse, The artery was severed. At that point it was a race to save her life and stabilize her. I don't remember much about how they fixed her up there, but they had to fly her to a different hospital and have a heart surgeon fix the severed artery in a more permanent fashion. Anyways, the heart doctor saw the grave situation and said she's got a 1% chance for her to make it. But he did such an excellent job that my mom is still alive and getting stronger each day. The moral of this story is, if you have insurance and are experiencing pain, go to a doctor as soon as you realize it. You may save your life and also save some doctors from an oh crap moment like this. It's sad you say if you have insurance and are experiencing pain, go to the doctor. It's so true. I have no insurance and pain, so I stay home. Not a surgeon, but I was having surgery on my breast to remove what they suspected was cancer. It was benign. But either way, I woke up during the surgery and I looked up and saw 4 people with scrub caps on, staring down at me. I looked at my boob in pure horror, and that is all I remember because they knocked me back out. Still makes me want to vomit thinking about it. I was only 13. That sounds truly awful. I sincerely hope you never experience anything as bad as that again. I was a 4th year resident and I was on call that day. Around 5 PM I went to do rounds, and as I got to the first room I came in to find the 1st year resident on top of the very recently neck operated patient. That morning he had a tumor removed from his parapharyngeal space. The resident was kneeling next to the guy's head with his hands and clothes completely covered in blood. There was blood on the roof, on the sheets, on the bed, dripping onto the floor, you name it. I was instantly petrified. I went to OMFG. I have never ever repaired someone's carotid artery. I am completely unqualified to help this guy. Someone please help us. I was the senior resident, so I was the only one on call at the time, and besides none could get there in time to help this guy. He was bleeding out, so it was up to me alone to help him. So I took the guy to the OR as fast as we could and I opened him up. All of the time praying and telling myself it's okay, I can do this. I can do this. I was crapping my pants while everyone was looking at me to fix him. I open him up and I see the freaking facial artery loose, spraying blood all over, so I clamped it, put a knot around it, and that was it. We closed him up, bandage and transfuse the poor guy, and I went to collapse on a stool. Well done, doc. I was the patient. It was a kidney biopsy. I was drugged up and out of it, but still awake, laying on my stomach as my kidney doctor worked behind me. He warned me, "You're going to hear a click and it will feel like Mike Tyson punched you in the back." Okay, I hear, click, feel the punch, then hear, oh crap, get so and so on the phone now. A nurse came up near my face to calm me and maybe keep an eye on me. I don't really remember everything. Apparently he had nicked a blood vessel and I was bleeding internally at an alarming rate. I got to spend the night in the hospital and pee what seemed like pure blood for about 24 hours. Never try to fit your kidney biopsy in on a Friday before the doctor leaves for vacation. Doctors, nurses who deliver babies. What are some strange funny things people have screamed while giving birth? When my brother was born, they had to use forceps to get him out. My mom saw them and screamed, "Those are salad tongs. You are not putting any goddamn kitchenware in there." When I gave birth and they pulled out the forceps, I thought they looked like ice tongs, not salad tongs, much bigger. The doctor who controlled the pain meds saw my face and asked if I wanted to remember any of this. I said nope. Last thing I remember. My mother's labor was extremely short. I was born within an hour, so that means that she went from experiencing minimal pain to extreme pain with little time to adjust. When my dad was driving her to the hospital, he unfortunately had to stop for gas. He went in to pay, and just then an elderly man in a wheelchair stopped him, asking him to buy cigarettes for him as the store was not wheelchair accessible. My mom then proceeded to lean out the window, yelling, "Don't help the cripple." We have never let her forget that one. I'm sorry to laugh at your mom, but dang, that was funny. I'm white, Irish ancestry, so I had red hair when I was a child, and my wife is black. Her sister was also in the delivery room. When the baby crowned, her sister told her she could see the baby's hair. My wife, who can barely breathe, blurted out, "The hair isn't red, is it?" Apparently she was terrified the baby would be black with red hair. My roommate and I just finished our labor and delivery rotation in July. During one of the births she was helping out in, the mom and the dad were separated but still good friends. So while this woman is pushing out her baby, she begins to half tell half scream that my roommate should date her ex, the baby daddy. The conversation went something like this. Mom, you should really. Screams in pain. Go out with. Screams again him sometime. He's really fun. Dad, I wouldn't mind some drinks sometime. What are you doing this evening? No, she did not go out with him. That would make a heck of a love story. Paramedic here. Delivered a baby for a lady who did not realize she was pregnant and called us for abdominal pain. Patient, you are an idiot. I am not freaking pregnant. Me, well, I can see a head crowning. Patient, that must be a freaking tumor. The tumor was a healthy baby girl. Mom was totally sweet afterwards. BTW. That is so crazy. How do people even do that? When my sister was in labor, she was screaming and our mom was trying to be comforting. It'll be okay. Take some deep breaths. It'll be over soon. Then my sister looks up at our mom and says, you have no idea what this is like. You just wouldn't understand, mom. Patient fully dilated, started pushing, then changed her mind. I don't wanna do this, I'm going the frick home, and then tried to get off the table. This happens. Holy crap, this happens. Fear 101. EMT who did a birth on the side of the road. Woman shouted frick me during a contraction and the husband casually replied, that's how we got into this mess. Damn it. I had a very hard time containing myself. Pretty sure my husband said this exact thing to me while I was delivering our daughter. I am not an obgyn, but I was questioning a patient in the about some other health problem. She wasn't carrying at the time. When I got to the part about the gynecological history, I asked how many kids did she have and how were they born. She had 2 kids and were both born with C-section. I should clarify that this was in Spain and the patient was gypsy. Now gypsies are not usually well educated and women often marry young and don't finish school. They also talk weird. Now, the lady told me she had 2 kids and 2 C-sections and I asked her why she had to deliver by C-section. She said because the first kid was a cum-cono. Well, this can be translated as pee eater. This lady was convinced that her first child was going to eat her pee and had to be taken out before he did. You can imagine my surprise. At first I didn't understand and left the room after the questioning, still puzzled. I went and started digging in her file and found out that the C-section had to be done because after she broke water the doctors noticed the amniotic fluid was filled with baby crap. Usually when a baby shoots in utero, it is a sign that the baby is suffering and has to come out quick. That was why she had a C-section. Now here is why it is funny. 1. In utero baby crap is called meconio. 2. The doctors probably told this lady that she had to get a C-section because the baby comes with meconio. 3. Comes with meconio equals viene con meconio in Spanish. 4. Viene con meconio sounds a lot like viene con mecono. Pee eater. 5. Imagine being told your whole life that your mom had to get a C-section because you were going to eat her pee when you actually almost died at childbirth. I know it must not be that funny in English, but I did my best translating it and hope some of you see how funny it was for me. This kind of translating to known terms seems to be common across languages. My mother recounted patients who claimed they had sickle cell anemia, and I, most embarrassingly, as a doctor's child, confused herpes zoster, the virus that causes chickenpox, with herpes zoster. When I was born, my dad didn't know that babies are usually born face down, and as I was coming out he screams, oh my gosh, he doesn't have a face. This is my favorite. I was high on meds at the time. I was begging for barbecue ribs in between contractions. Come on, honey, the nurses will never know they were standing right there. Apparently, when my aunt was giving birth, she was all jokes. Very angry jokes, but jokes nonetheless. Knock knock. WHO's there. The baby. Not yet. This is my favorite LOL. Not a doctor, but a father. When my first child was born his head was kind of misshapen, and when the doctor lifted him up to show my wife she yelled, why the frick does he look like a raptor? I lost it. My dad has told me they thought I was a girl all the way up to birth. I came out as a C-section and the doctor goes, "Ha, this one's got extra equipment." My wife told me, in a satanic voice, to get better ice chips. These suck. I am not sure what the quality issue was, but I ran and got her a different cup full. The nurses kept trying to give me ice chips and telling my boyfriend to give them to me. Between pushing and one point I just got pee and told them no, I don't want IT. I was too busy pushing a baby out of my vagina to eat any freaking ice chips. I'm a nurse, but I'm also a mom. My husband told me when I was breathing the laughing gas I screamed I'm Lady Darth Vader as I was pushing. Then I asked the doctor if he felt my tonsils when he had his arm up there. These are my co-workers. I hope they let you live it down. I'm a nurse and one of the strangest things that I've seen happen while someone is giving birth is one patient decided to tell her boyfriend that it wasn't his baby. That made the whole room silent and the boyfriend just left without saying a thing. When my first was born, a nurse told us about a black baby being born unexpectedly to a white mother in full view of her white husband. This was in the 80s in my very conservative white town. She said both sets of parents were there and you could have cut the atmosphere with a knife. During labor, about a half an hour before the god-awful ripping and tearing, I was losing my crap. My older sister panicked and ran around the room. My mom, the birth coach, said to my sister to give me a focal point, something to concentrate on so I didn't jump out of the nearest window. My sister lifted her shirt and shows us her boobs. Hilarity and awful pain ensued. After a long contraction, I said quietly, "I'm gonna set everyone in this room on fire." Everyone laughed, including the nurse, but I think my devoutly Christian mother-in-law started to cry. It's times like this that I wish I was a woman so that I can scream wildly inappropriate and zany things during my pregnancy. Then I say that again and realize I just wished I could give birth, roughly aware of how painful it might be. All better. Not exactly during labor but right after. I had a very bad tear during natural childbirth which meant lots of stitches. Add to that it was training day for one of the med students and it was taking a long time. A really long time. Finally I look down between my knees and ask, "What the heck? Are you guys weaving a friendship bracelet down there?" Both doctors, the intern, and the med student burst out laughing so hard they had to stop working. Apparently there was some issue with how the intern was stitching me up and things had gotten tense. This lightened the mood quite a bit. I am crying. After I had my son I was pretty wasted on all the pain meds they'd given me. I looked at my husband and said, "Honey, Condoleezza Rice is out there waiting for me. Tell her I can't come out to play today. I just had a baby." By third, I was delirious so I don't remember much. Hyperventilating because I thought something was wrong. Pain was much more intense than my first two. I get to the hospital at 11:15. Have my son at 11:24. After everything is calmed down the nurses start giggling. Apparently I had yelled at them to take off my pants and look up my CU dick holes. I had a C-section and was pretty out of it. When they held up my daughter and said, "Here's your baby," I responded, "That's not mine. I've never seen it before in my life. Take it to Lost and Found." I've never seen it before in my life. Well, there's some accuracy in that statement. As a nursing student I was watching a planned C-section. The procedure was being performed by the senior resident. Everything seemed to be going well when I heard the resident mutter whoops and I looked up and saw blood squirting out, pulsing. She fixed the artery very quickly but it obviously freaked out mom and dad. Everything turned out okay for mom and baby. At one point when I was having contractions I said "foo-woo-uck" really loud and long and my husband said "There's $1 for the swear jar," which is our little inside joke. But the nurse thought he was serious and tried to give him a condescending lecture about how painful childbirth is. Until I told them both to shut the frick up or get murdered because seriously shut the frick up. A friend's mom is a nurse. Nurse, have you seen the mucus plug? Woman in labor. Yeah, that moron went out to have a cigarette. I actually do deliver babies. Most women don't scream anything coherent. It takes too much energy to form clear thoughts, much less say them out loud. If anything, they say things they want, like water, but always very short sentences. My back, my clit, it burns. Oh god, I can't. No more. Why isn't it coming? What's wrong? Pull it out. A young couple, mom and dad were both around 18 if I recall correctly. First baby for them both. Mom's pushing and dad is doing this awkward jig wanting to be helpful but not really knowing how to be helpful. At one point I say, okay, we can see the head now. Still a while to go. And dad jumps up, runs to the counter, puts on rubber gloves, and gets into football receiving position, like 10 feet away from mom's legs. We all burst out laughing and he was very embarrassed to learn that babies do not shoot out across the room to be caught like a football. When my mother was pregnant, she and my dad decided to have an amnio. A stand-in doctor was there the day she found out the results. And despite mum's instructions that she did not want to be told the sex, the doctor congratulated her on having a healthy little boy. My mum freaked out and decided not to tell my dad, so as not to ruin the surprise. Fast forward to the day of my birth. I'm brought into this bright world without a penis. The doctor congratulates my mother on her little girl. My mum responds by yelling, "You've got to be freaking kidding me." Silence from everyone in the room. The doctor then has a serious chat with my mum about loving me even though I am a girl, etc, etc. Turns out the amnio results were mixed up with another woman of the same name. Yeah, quite the confuzzle. She wanted a surprise. Sometimes you get what you wish for. Not a doctor, but during the birth of my firstborn I kept screaming I got a poop. I got a poop actually. It was a head creating pressure as it was coming down the birth canal. Felt just like an 8-pound poop. Not nurse doctor. When my mom was delivering me, she pulled my dad down to her level by his shirt and said, "Get the frick out of my face." My mom did this to my dad. He had been working out of town and rushed to get there, and she told him to get his nasty coffee breath out of her face. No one was responding to the call button as my mom was giving birth, so she yelled, "Do something honey," so my dad ran out into the hallway and screamed at the top of his lungs. "IT's showtime and I'm not a very good catcher." Clearly you have an exceptional memory. Fortunately, when I gave birth to my nephew it was a quick labor. Apparently, though I was stoic as heck, my eyes would roll back in my head every time I had to push or had a really tough contraction. But I didn't say anything. I bit into my lip though until it was bleeding during the last couple of pushes. Apparently everyone looked up from the baby and I'm streaming blood from my mouth. Freaked my sister and the doctor out for a moment, lol. The delivery nurse for my son's birth was about 4 minutes and 11 seconds. She kept talking to me and I couldn't see her over my belly and legs. It was really frustrating. She said, "Do you want me to pull down the mirror so you can see?" I was like, "I don't need the goddamn play-by-play, let's just do this." I apologized afterwards. She laughed. That was me. The nurses kept trying to romanticize the moment and make it memorable, and I just wanted it to be over so I could go home. Oh, just thought of another one. For one of my pregnancies I ended up having an emergency C-section. I was drugged to the eyeballs and I remember really liking one of the nurses because she smiled a lot and quoted poetic lyrics from my favorite songs. When the drugs wore off I remembered I was the one quoting the lyrics. No wonder she was so smiley. Kind of irrelevant, but I woke up in the middle of my wisdom tooth surgery hearing someone playing RHCP. Turns out I was trying to sing as the oral surgeon was trying to gauge bones out of my mouth. My fiance is a doctor and my mother's a nurse, so I'm claiming the titles by association for the purposes of this thread. My mother was unexpectedly having her 4th child and chose not to find out the sex. We like surprises everywhere, apparently. For some reason, she became convinced it was a boy and would have bet the house on it. In the delivery room, they hand the baby to my dad and he joyfully tells my mom that they have a new baby girl. Mom, what? Number? Check again. Dad, I'm pretty sure it's a girl. Honey, Mom, you're not looking hard enough. My older sister cried when she found out I was a boy, and both of my older brothers danced in jubilation. To this day she doesn't remember this. My wife had her epidural for the C-section and at one point asked, "Is it out yet? I really should get home now." So I answered, "No honey, they still busy cutting." Her reply had the entire orange stitches okay. Tell them to neaten up while they're in there. Oops, not a doctor. I was standing in the corner under strict instructions not to faint or throw up. Right after my son was born via C-section, I was still higher than a hippie at Woodstock from the drugs they gave me. They handed me my beautiful newborn son and the first words out of my mouth were, "Oh my god, his scrotum is huge." Then I laughed hysterically. To be fair, it really was. Baby scrotums are huge. Jesus. When I was doing my rotations in the well baby unit, I was weirdly disturbed by how massive they all were, wondering how to bring the subjects up, until a very large, intimidating Polish nurse picked one up and exclaimed, "Dang, look at the balls on this one," and I felt better. During my birth, aside from my husband, my best friend was in the room. She had recently been certified as a doula. For those of you that don't know, a doula is support for the mother. They don't do anything medical, but can help support the mom or her partner, help with pain solutions, etc. I stubbornly wanted to deliver without drugs, and during a particularly bad contraction she leaned in and told me to think of my Wonder Focus, something you are looking forward to learning about your child when they are born, like an incentive. So hair color, weight, sex, etc. I looked her square in the face and told her to shut up with her hippie bulls. I was in labor for 22 hours. Pushes for 2.5. For those of you who don't know, an average first-time childbirth is around 12 hours with around 10-30 minutes of pushing. Needless to say, I was freaking tired. About 2 hours into pushing, I couldn't push anymore. I said I can't. The doctor yelled at me and I lost it. "Shut your W mouth." It got me mad enough, and around 5 pushes and 3 snips later I popped out a 10-pound baby. We found out post-delivery that I had literally ripped my uterus, which is why it took so long and hurt so bad. So much blood. Ripped uterus. Just tape it back together. Not a doctor, but was present for my cousin's birth. My 90-year-old grandma was there, sitting on the other side of the curtain. She wanted to be present but didn't want to see anything. She had never witnessed a birth before and doesn't remember anything about having her own 4 children. As the baby came out, everyone on the birthing side of the curtain was cheering and excited. This caused my grandma to decide she needed to open the curtain to see what was going on. She actually clutched her chest and fell back into her chair in horror. Nearly 12 hours of labor, and to this day, that's about the only thing I remember. It's not really surprising that she doesn't remember her own labor. They used to all but knock women unconscious while they were pushing. Probably happened that way during your grandmother's time. Out of the office goodie. I've been doing this for the past month on a rotation. I think by far the one that made me and the nurses laugh the most was a woman with a thick Jamaican accent that kept saying "oh you bad boy" over and over in between contractions pushes. My most vivid memory from a 3-month obstetrics rotation over a decade ago, screamed by the largest Glaswegian woman I've ever seen. "Take IT back. Freaking take IT back." Not me, but my mom delivers babies. She was telling me that one time there was a woman that went to push and open up her mouth and had the longest drawn out scream ever. It was so long that everyone was kind of looked at each other, checked their watches and tapped their foot. Once she was done, my mom went up to her and said, "You only get to do that once during a delivery and you just used yours. Apparently when you scream it takes all the power from your push. Just try pooping and screaming and you'll get the idea." Apparently this woman was actually a psychiatrist. Mind over matter, am I right? I'm laughing at the image of Redditors worldwide pooping and staring straight ahead, yelling shamelessly as William Wallace leading an army of rebels into battle. I was in the delivery room because the father wasn't available. She knew it was a girl for some time, but as they put the baby on her after it was born, she looked down, saw the umbilical cord and yelled out, "Hey, it is a boy." I don't remember this because I was very out of it, but I've seen the video. Hubby wanted to see how I was doing and he pulled off my oxygen mask and asked how I felt. I started in with the litany against fear from June. I must not fear. Fear is the mind killer. Fear is the little death that brings total obliteration. You are awesome. I just made jokes about them not tracking sand in their C-section. Doctors of Reddit. How often do you see patients after they have tried to self-medicate? What's the worst mistake you've seen? I was working in a clinic when a man came in with his blind wife. She is diabetic, and during my questioning I found out she had had a few episodes of low blood sugar in the past few months. And I mean low as in unable to ingest food to raise her blood sugar. The husband told me he had to inject his wife to bring her around. Usually, in these cases you would inject glucagon, which is basically the opposite of insulin. It raises blood sugar. He proceeds to tell me that the glucagon is too expensive, so he has been dissolving sugar in water, drawing it up, and injecting it into her thigh. I tried to hide my shock, but it must have been obvious. He just looked at me and said, "Well, it worked, didn't it?" I tried telling him all of the reasons he should use glucagon and not sugar water, but he wouldn't have it. I even told him that the pain of the injection is probably what woke his wife up, not any increase in blood sugar. He said the glucagon was too expensive. I called around to a bunch of pharmacies and found it for $20 for 2 injections, but he still refused to buy it. We ended up calling Adult Protective Services. TLDR. Husband injected his blind diabetic wife with sugar water to revive her from low blood sugar episodes. Good job. I am very glad you called Adult Protective Services. Lady in her mid-60s comes in with a terrible burn on her hairline and scalp. I ask what happened, and she said she was coloring her hair with the leftover dye from a month or so ago. Needless to say, she had a 3rd-degree chemical burn all over her scalp. Okay, that's problem 1. We ask her if she has any allergies because we want to give prophylactic antibiotics. She says no. We ask about her daily meds. She rattles off a bunch, including 1000 milligrams of amoxicillin, Augmentin. We ask how long she's been taking the Augmentin. She replies 2 years. Every day, for 2 years, she's been taking massive doses of antibiotics. Her reasoning: to keep myself from getting sick. We went hunting for side effects. Found oral and vaginal thrush, massive yeast infection in her colon, malnutrition, stomach ulcers, and multiple open sores on her feet and knees. Plus, she got a super infection on the burn site a few days later. No fun. TLDR. Don't take antibiotics if you don't need them. Seriously. Not a doctor, but when I was about 16, I started having these little red irritated spots show up on my arm. My mom was immediately like, "You have psoriasis is all, just go tanning." So I tanned for about a week, and they just got worse. Now I had them all over my body. I had spots on my eyelids even. So I go to the doctor finally. Turns out I had ringworm, and by tanning, I was basically rubbing them all over with the lotions and incubating while I tanned. Thanks, Mom. I posted in a thread above this about how I got ringworm from a tanning bed. IT was you. Pathologist. I've seen a few cases of patients who basically wreck their livers through use of some sort of herbal remedy, like for weight loss or something similar. Be careful with unregulated dietary supplements is what I'm saying. We got given a case in a lecture of a man who had a rash on his foot, googled it and decided it was eczema or some similar inflammatory disease, so ordered and applied a steroid cream. For those who don't know, these kind of steroids act by dampening the immune system, the overactivity of which is the cause of diseases like eczema and psoriasis. However, he in fact had a fungal infection and was just reducing his body's ability to fight it off. If I remember correctly, by the time he got to the doctors he needed it amputated. TLDR. Go to the doctor. I have a weird rash that I can't diagnose on Google. This just convinced me to schedule a doctor's appointment. Pharmacist here. Patient came in and wanted to self-medicate his cat's Pinky. He wanted to know what the vet would prescribe and if it was available somehow over the counter. After a long and trying discussion, he is insistent on putting generic Neosporin in his cat's eye. I repeatedly instructed him that it wasn't safe due to sterility reasons and that it could harm the cat, worsen the cat's condition, or cause some other problem for the animal. His reply to me: "Well, I'll try it in my own eye first and see." And just like that, as mysteriously as he arrived, he was gone. A doctor. First one that comes to mind, although probably not the worst, was a woman who came in with worsening back pain. She had fallen the previous day and filled a gallon-sized bag with ice and placed it on her back. She fell asleep with it on her back, and a few hours later she noticed that her back hurt even worse. So she took another bag of ice and put it on, and once again, fell asleep. When I examined her, she had 2 large areas of burns with blisters on her upper back, each about 6 inches in diameter. When I took a picture and showed it to her, no, I will not post the picture, her eyes welled up with tears. She couldn't believe that ice had given her a 2nd-degree burn. Lesson 15-20 minutes at a time every 2-3 hours maximum for heat or ice packs. TL. DR. Patient left ice on her back too long, got a nasty burn. I work in a dental office. Most common thing we see is people placing an aspirin on their gums next to an aching tooth. All that does is severely burn the gums and makes the pain worse. I've also met a few people over the years who have taken their own teeth out with a pair of pliers. One guy we saw had a problem tooth. Went to pull it out, pulled the wrong one, then tried again and pulled the problem one. He shattered the alveolar bone in that area and had to be sent to an oral surgeon immediately. Resident physician here. I've had numerous patients who've rejected medical treatment for a small, localized, and easily treatable cancer in favor of naturopathic homeopathic remedies. Inevitably, they re-present years later with diffusely metastatic cancer in their brains, liver, bones. It's everywhere. By that point, the conversation shifts from how I can cure them to how I can make them comfortable before they die. For example, woman has progesterone receptor positive breast cancer. This means that the hormone progesterone will make her cancer grow faster. She goes to her naturopath, who prescribes her tubs of progesterone cream for years, which most certainly made her cancer worse. But it's okay, she tells me. It was years of natural progesterone. Nurse here. At a get-together with friends, where the wine drinking got out of hand, I had a friend burn himself on the oven while making pizza, then try to cauterize that wound with his lighter. I'm an EMT. One of my first calls was an 80-plus-year-old man living in an assisted living facility. He had bought at least 150 bottles of some naturally lose-weight quick pills that he saw late night on TV. He had been taking an excess amount of them for at least a day straight. We got there and his mental status was clearly altered. Didn't know where he was, etc. I wish I still had the picture of the stacks of cartons he had in his small room. I still wonder how he got them inside of the facility. Med student here. Literally all the time. I've seen super overdosing OTC meds guy with bloody stool and abdominal pain who we found out used 4 goodie powder packets a day for over 5 years. Patient who had someone try to nail file his hemorrhoids. Not sure how he thought that would help. Massive infections from people literally stapling a wound shut with an office stapler. I had a patient who came in saying that she had a sore throat, so she took her cat's expired antibiotics and wanted to know why she wasn't getting better. Well done, they'd expired. Geez, talk about stupid. Physician here. The one that stands out from among the rest of the field. Life-threatening problems with OTC acetaminophen, ibuprofen, naproxen happen all the day long. Happened many years ago while I was a medical student. I was serving my rural medicine rotation at a primary care practice in the sticks. A man came in for an urgent appointment for a rash. I went to see him first to get working on the history. In the exam room I met a very nice, young, fit man sitting bolt upright on the exam table looking very uncomfortable. During the history, it was revealed that he was a telephone line repairman and was working, in late summer, out on the telephone lines around the county, climbing them to reach the wires. He had been exposed to poison ivy this way over both arms and much of his torso, which had happened before. However, this time the rash was worsening with time. I asked him to remove his dark-colored shirt, and after he did I almost fainted. He had open wounds all over his arms and chest. All of the blisters from the poison ivy had unroofed and the tissue underneath was destroyed. Everything was bright red, bleeding, and weeping. It looked intensely painful. I'm having a hard time describing it. It was the worst skin findings I'd ever seen. I thought for sure this was Stevens-Johnson syndrome or 10, so I started asking about medication use. He told me he takes no medications at home, but that his grandmother gave him a gallon of solution to put on the rash, which he had been using regularly since the poison ivy began. He didn't know what was in it. We called grandma. What was in it was bleach. He got to go for a fun trip to the burn center. Poor guy. TL. DR. Man treated really bad poison ivy with bleach. Lots of skin was lost. Heard the story, but didn't see the patient. A woman in her 60s presented to the OR with episodes of passing out during sex. She underwent a full workup, cardiac, neurological, when she was admitted, and no cause was found, so she was discharged. She returned again with the same complaint a few days later and divulged that this had actually happened during sex both times. Upon further questioning, it turns out that her husband had been using topical nitroglycerine paste on his penis for erectile dysfunction. When they had sex, the medicine was absorbed into her bloodstream, causing her blood pressure to drop precipitously. Her husband was advised to discontinue this practice. TLDR. Stick to Viagra. People with tooth pains trying some miracle remedy, and when the pain stops they think they are healed. What they don't know is that it means their nerves have been infected. In fact, so serious that the nerves died and rotting below the gums. Only until the pain starts again and their so-called remedy doesn't work do they go to the dentist. By then there is no choice but to remove the teeth and probably some additional surgery too. BTW dentists poke sharp objects at your gums for a reason. It's to check for periodontal disease. Most dentists also don't fool with making payment arrangements. This means people with no money get no dental care. Given the risk that I've heard comes with untreated abscess, I find it really concerning that dental insurance is not mandated by the ACA. I did an MRI on a patient who had treated her breast cancer with sodium bicarbonate. The patient presented to them with numb hands and neck pain. The MRI showed extensive bony metastases and a pathological fracture of C2. Basically, the cancer had spread all through her body and had weakened her bones to the point that they were disintegrating, putting her at risk of damaging her spinal cord. Or worse. It's more just sad that people want to believe that these simple remedies can treat complex issues as opposed to modern medicine. I'm a medical student. I have two that stand out. First, we had a guy come into the free clinic complaining of knee pain. He is a larger guy, an ex-football player who developed a bit of a gut after he stopped playing. He said that he has some old injuries, torn meniscus, chronic arthritis, etc. He used to go to his doctor in another state, who would drain the knee and give him a steroid injection every so often. When he lost his job, he lost his insurance too, hence being seen at the free clinic. Before he decided to come to us, though, he decided it was a good idea to take a needle and try to drain his knee himself. 4 times. On physical exam, the knee is massively swollen, tender, bright red, classic signs of a septic joint. We weren't equipped to treat it in the free clinic, so we strongly encouraged him to go to the ER. He didn't want to go because of his insurance situation. We tried to explain the gravity of the situation to him, but he refused to listen. Without prompt treatment, he could end up losing his leg. We offered to call him an ambulance to take him to the ER, but he refused and left the clinic. Never did find out what happened to him. Second, this one I heard second hand from a classmate. We had a firefighter come in with some burns on his leg. I believe they were incurred from a drunken cooking accident rather than any on-the-job heroics, but I could be mistaken. Anyway, the burns were serious, but he was expected to make a full recovery quickly enough. He was discharged and instructed to eat a lot of protein to help him recover. He interpreted this as get as much protein into your body as possible, by any means necessary. He goes home, takes some protein powder and mixes it up with water, and sets it up in an IV. Needless to say, he developed a pretty serious bloodstream infection. It prevented his burn from healing correctly and he ended up needing a partial amputation of his foot. He eventually recovered, but it took way longer and there were so many unnecessary complications. I'm a pediatric nurse. Parents brought their child in with weakness. Through the general admission questions, we discovered that they were into natural treatments. When their infant child developed tummy problems, they decided to give her a bottle of honey water to help with that. The baby was diagnosed with botulism. It says right on the honey bottle not to let kids under like 2 eat it. We had a patient come in who was using duct tape to treat various skin ailments. Not the end of the world if you have a wart and just use a small piece of it only on the wart. This woman was using giant strips of duct tape that she'd leave on for months at a time, on her face, her arm and foot. When the duct tape was removed, huge square portions of her skin came off with it. She has a long, rectangular scar on her face now from it. Not self-medicating but something even worse, ignorance denial. Woman came in with a tennis ball sized tumor extending out of her left breast. When asked why she didn't come in earlier, she said she thought it was normal. Worst mistakes I've seen are patients coming in for treatment when it is too late and the disease is way too advanced. My mother-in-law, rest her soul, had finished menopause previously and was bleeding vaginally for 2 years before telling anyone. Kids, doctors. She fought for 6 years but cervical cancer took her life. When she was first diagnosed it was at stage 4 already. Please people don't be freaking stupid. If there's something wrong get some help. As a veterinarian, the holy trifecta are giving aspirin to cats, giving ibuprofen to dogs, giving estrogen to dogs, usually done by MDs or nurses. All 3 of these run a good chance of killing the animal. Not a doctor, but I was observing in the ear for this. During my senior year in high school, I did a program called New Visions that allowed seniors to skip half their day at school and instead spent it job shadowing doctors, surgeons, nurses, physical therapists, etc. I did surgery, saw a bunch of births, vaginal and C-section, assisted during codes, and was eventually certified as an EMTB through the same program. It was awesome. Man comes into the air after trimming trees on his farm and a very large branch had landed on his head. He had split his skull and instead of going to the ear, he had his wife clean his scalp with vodka and staple his scalp shut with a staple gun and thick sewing thread that they used on horses. According to him anyways, it was severely infected and nearly gangrenous. Several of the staples had created microfractures on the skull too apparently. The doc's face when the man nonchalantly described how he just got drunk and had his wife use the staple gun on his skull was hilarious. Guy had to go into surgery and it took about 6 hours and several skin grafts to repair the damage. That sounds like an awesome program. You were really lucky. Only semi-related, but the gym teacher at my junior high had a student who broke his arm during class, and the teacher's response was to insist that it was only a sprain, and that the student should do jumping jacks to help it feel better. His classmates had to call him an ambulance. My uncle is a doctor and a few years ago, when I was trying to figure out if I wanted to go into medicine or not, he let me shadow him in his office for a day. Well, this one girl came in to see him. She was absolutely beautiful, mid-20s, perfect makeup, hair, everything. She was in to see my uncle because her toe was in unbearable pain and she could barely stand to walk anymore. Well, my uncle has her take her shoe off, and I almost threw up. He had to take a second and turn away to collect himself. Her toe was like 3 times its size, and the outside looked slimy and like the skin was about to drop off. After a few seconds of stunned silence, my uncle asked what happened to it. She said she was walking one day and she cut her toe pretty bad on some glass while she was at her apartment. She called her grandmother and asked if there was anything she should do to stop the bleeding and heal the infection. She said her grandmother was a shaman, and apparently she went to her for all medical advice. Well, guess what the grandma told her to put on it? Mayonnaise. Yep. She didn't even clean it or anything, just plopped some mayonnaise right on it. We asked her how long she had been doing it for. 2 weeks. Constantly. The smell was absolutely terrible, and when my uncle even slightly poked it with something, she would almost scream in pain. He immediately told her to go to the hospital and told her that one of his buddies would be waiting there for her. So later that day, my uncle's friend calls back and said that they had to do surgery on her toe, and that there were 2 or 3 pieces of glass embedded deep in her toe. He said that when the surgeon made an incision, the toe basically exploded and pus went everywhere. They had to remove all the dead skin, and almost had to remove the toe because the infection was so bad. But apparently she made a really great recovery, so that's good. Me and my uncle will never forget that though. I'm not a doctor, but I work at a pre-post surgical eye clinic. The worst I think I've ever seen was someone wore their contacts for 3 months straight. It was gross. Remember guys, take out your contacts at night and wash them like you were told to do. After my mother's friend had her cornea fall off, I'm very protective of my eyes. I just can't understand how they do that. Mine get dry and uncomfortable after half a day, and sleeping with them and just makes it even worse. Just take 5 minutes to change them for God's sake. Guy came in with a deep laceration to the leg. Genius decided he would super glue the wound shut. It became infected and then gangrene set in. He then waited until his leg was a greenish black before coming in. He lost the leg. I work as a caregiver. I had a patient who tried to holistically cure Parkinson's for 10 years. When I started caring for him, He was a human statue who could only communicate by blinking. His crazy hippie mother was behind a lot of it. She brought in shaman, healing gazers, oil enemas, you name it. After 6 months of this, I dragged his butt to a neurologist to be put on meds. Today he walks, talks, plays piano, goes to a local college, and even puts on concerts. When I think of those 10 wasted years, I just shake my head. To this day, the minute someone starts yammering about alternative medicine, I shut that crap down. I've seen what it does to people. I am not a doctor, but this is important. About 10 years ago, my now mother-in-law had what everyone thought was a severe panic attack or mild heart attack. They rushed her to the hospital and found out it was her gallbladder. She said it was nothing serious and didn't get it removed. About 3 years later, same thing happens. Possible heart attack, turns out it's her gallbladder. Her husband, my wife, and I were all there in her room when the doctor is recommending taking it out. She says no. The doctor then tells her no more spicy food, junk food or fast food. After he leaves, she starts going off about how doctors just want to cut people open to make money. And I swear, she says, I just need lemon juice. That will fix it. Fast forward another 3 years later of not listening to her doctor and taking lemon juice. My wife gets a call around midnight from her dad, who is mumbling incoherently. After about 30 minutes he explained to my wife that my mother-in-law had woke up screaming painfully and he had rushed her to the ER and was scared she was going to die. The hospital had told him that she was going into emergency surgery. About 4 hours later we found out that they had removed her gallbladder and that it had actually ruptured. She is still alive and still tries to give my wife and I medical advice. Don't you just love that part with the being incredibly wrong and yet still they have to know better than everyone? It is amazing how many people truly believe DRs are all buttholes. MD here. Patient a few weeks back came in very yellow, jaundiced, and had hundreds of marks over his entire body from scratching. Severe pruritus. His liver function tests were through the roof. Total bilirubin 28. We did the full workup, labs, ultrasound, MRI, even liver biopsy. Nothing obvious. Turns out the guy was taking supplements by the handful from GNC. He had acute vitamin A poisoning. Great case. Gynecologist friend in Lebanon told me about women trying to abort by themselves due to abortions being illegal. So you have the patients coming into her with hemorrhages due to knitting needle insertion, and that is a classic. But a very frequent case is massive septicemia due to the insertion of a raw piece of meat, or sometimes a dead bird. The crazy part is that those cases happen quite frequently. Medical professionals of Reddit, when did you have to tell a patient I've seen it all before to comfort them, but really you had never seen something so bad, or of that nature? I used to do psychiatric evaluations in an emergency room setting. One time, I'm evaluating this 60-year-old woman who is lying in the hospital bed. I'm asking her questions, and she stops me and says, "Excuse me, but I need to pass some gas." I let her know that this is a medical setting and that is a completely normal body function and not to be embarrassed. People pass gas all the time. I was not prepared for what came next. She let it rip, and out came the loudest, wettest, and longest sounding fart I have ever heard. It was bubbly and juicy, hitting all the deep notes while ending on a squeaker. I don't think Satan could have made a noise like that with his anus. It sounded so relieving. But then the smell hit me. It was bad enough that I started to gag and had to excuse myself from the room. When I came back, I politely asked if she needed a nurse for anything in case she needed to be cleaned up after that, but she declined. Obviously I've witnessed people farting before, but I've never heard or smelled anything like that before. That was something else. 4th year med student here. On my rotation a couple months back, I walked into the ED and was immediately asked to help a nurse and resident put a catheter in a patient. Now a catheter placement is usually a one-person job, so I was pretty confused as to why they needed my help. I walk into the patient room, and I'm immediately greeted by a disgusting rotting flesh smell. Worst thing I've smelled in my life. The patient has to be pushing 400 pounds and has the worst edema, soft tissue swelling, from congestive heart failure I've ever seen. His scrotum and penis foreskin are about the size of a small watermelon, and the foreskin had swollen completely over the tip of his penis. The nurse had a speculum, tool OBGYNs use to look inside vaginas. inserted into the man's foreskin while the resident took the catheter in a hemostat, pliers type thing, and jammed it into the man's pee hole for 20 minutes. They finally got the catheter in and took the speculum out. It was covered in a thick brown discharge that looked like fermented pea crap. I still don't know how he let his scrotum and penis swell that much. Welp, that's enough Reddit for today. Not a doctor, but had one that defiantly lied to me. So I have an extreme reaction to poison oak. After a day my skin literally starts slugging off, exposing the fatty tissue. It then starts growing away from the contact point, doubling in size every day until I get treatment or die of infection. Day 1. Man, this poison oak is itchy. Attempt not to scratch, but you do. Day 2. This is bad. I must have an infection. But I did everything I could to keep it clean. Call the doctor. Make appointment for Monday. Day 3. Wake up Saturday stuck to my sheets because the gauze is too saturated to contain my body fluids. Make an urgent care appointment, but make it for the afternoon cause I got to see the kids' soccer game. Upside. It doesn't itch today. No pain at all. Doctor sees me, makes a phone call, tells me to sit there and don't move. An hour later, another doctor comes in wearing some kind of hazard suit. I start freaking out. He tells me he is a specialist dermatologist and has seen it all. Also comforts me by saying, worst case scenario, it's flesh-eating bacteria. The fact that you're not dead by now might mean you have superpowers. He starts to remove the gauze the previous doctor wrapped me in. And as soon as the affected area was revealed, he threw up his hands and jumped back. Then says, he's not seen this before and wants me to describe everything in detail. He takes swabs, sends to lab, prescribes me steroids and antibiotics, brings me the prescriptions, and after sitting in the little room for a total of 8 hours lets me go because I've stopped leaking. I saw him again on Monday and the labs had nothing terrible and I was completely scabbed over. He had me finish all the pills, saw me 2 more times, and I didn't even get any scarring. Just my body getting rid of the poison oak by getting rid of all the skin. Sounds like Stevens-Johnson syndrome. For God's sake, be careful. Other plants and drugs can do that to not only your skin but also your eyes and certain internal organs. Obligatory, not a medical professional, but a first aider. I was doing a duty at the finish line of the London Marathon as I have done for many years. I've seen enough chafing, dehydration and blisters galore. Someone always has the worst of the day, but it happened so fast that you can hardly mentally tally whose nipples were the most raw. Until I had a runner come in covered in blood complaining that her nipples had completely gone. She had chafe so bad that her nipples and areolas were rubbed to nothing. And the worst part was that she had her nipples pierced and the piercings had embedded themselves in her exposed breast tissue. I had to talk her through sterilizing the wounds while trying to assure her that it happens to everyone. The image of a nipple bar peeking out of red, raw breast tissue will haunt me. I was a fat little 10-year-old with a slide on a float in the middle of the lake. We had a bucket on a rope to pour water on the slide before you went down. I missed a spot. My right nipple very literally was burned off by the hot plastic. It took years before became somewhat normal again. Doc here, currently working with accident victims. I had a patient once hobble in, walking in his chelator, a week after being hit by a car. He'd been to the ER. They discharged him and said just the usual bumps and bruises. I did my round of x-rays, and his femoral heads were broken on both sides. Think of the leg bone as a capital L, with the bottom of the L hooking into the hip. His were cleanly broken through the bottom sections on both sides. Turns out he'd had occult fractures on both sides the x-rays didn't initially see, and walking on them collapsed them. Never seen that before. Another was a patient with shoulder injury, both sides. Got an MRI, and both shoulders were basically destroyed. Complete failure of the rotator cuff on both sides, with the humerus being drawn up and back on each side. Instant surgery. I'm a medical secretary for a podiatrist. I obviously didn't treat the patient myself, but I discussed his case with his doctor. The patient had severe anxiety and therefore hadn't been to a doctor of any kind in approximately 20 years. He ended up in our office because his wife had called the day before and expressed that he needed to be seen due to a foot infection. When he arrived, he approached the window and told the receptionist that he was sorry because his socks were dirty as he hadn't made it to the laundromat recently, which was a bit weird in and of itself, but we work for a podiatrist. We've seen it all before, as it were. He then sat in the waiting room, and it was mere moments before the smell seeped into the administration office. The receptionist put him in an exam room as quickly as possible, and upon her return, she informed me that the infection was literally oozing out of his sneaker. All we could do was open the windows and apologize to other patients as they arrived. It was foul, and when I entered the room after his appointment to clean it, the medical assistant was out that day. I immediately began gagging and had to forcefully push my manager out of the way as to avoid vomiting on her on my way to the restroom. As it turned out, the dude had had the infection for approximately 3 months and had been showering with his sock on since he'd discovered it. He literally hadn't removed his sock from his infected foot in 3 months, and his wife had somehow been living with the overwhelming smell. The doctor said it was the worst infection he'd ever seen, but the patient was so incredibly anxious that he got the standard "I've seen it all before" throughout his appointment. I was working as a CNA in a nursing home. There was a lady who had been neglected before she came in, so she had stage 4 bed sores, all the way to the bone, and the treatment nurse wanted me because I am calming and really good with the residents that needed a little support. She has me roll her on her side and then carefully peels back the bandage. I'm staring down in half horror half fascination as I can clearly see the bone, ligaments, muscle, layers of skin. I'm gawking hard and the nurse is showing me some neat procedure when I hear a small, frail voice. "Is it getting better?" I turn on my biggest, friendliest smile and reply, "It does. It looks so much better." "Does it feel better?" She smiles and nods. I change the subject to grandkids. She had a picture of them. I haven't seen anything like it before or since. But she was such a lovely lady and I started looking forward to helping because she was such a nice lady to talk to. Thank frick there's nurses like you. Not the doctor, but the patient. In 6th grade, I contracted so many different forms of dysentery that I was placed into CDC quarantine while they tried to figure out where I got it. I was barely conscious throughout the whole time, but all I remember is my doctor in my room with me, having hooked up my Wii and playing Brawl as I recovered. I had no clue that my parents were being investigated for child abuse or that I was in quarantine until a few months later, or that I had passed out and had been covered in vomit and crap for hours before my mom found me and took me to the hospital. I ended up getting it from someone not washing their hands after handling a snake and then cooking dinner at my science camp. Wash your dang hands, people. The dang Oregon Trail over here. I'm an RN who specializes in wound care. We see a lot of crazy things in my clinic. A common occurrence is a pilonidal cyst, which is an abnormal growth in eugluteal cleft aka butt crack, that contains hair. It usually happens with younger PPL, say 13-20s, and is obviously very embarrassing to the patient. When we get them, they've already had the surgery to open and extract the cyst, so there's a few holes left that we have to heal. One poor soul that came in had the worst post-surgical hole I've ever seen. It was so big, it extended from the top of her crack to the top of her anus. The nair on either side about 12 centimeters. It was like the surgeon carved out most of her butt. The patient was devastated, and I tried to comfort her by telling her she's not the worst I've ever seen. Poor girl. Not a medical professional, and the dentist didn't even try to play it off as if he'd seen it before. But my sister had bad problems with her teeth. So many of her teeth were pulled, and one was sawed in half while it was still in her mouth so that they could pull half of it. As our dentist held the saw, he said, "I've been telling all my dentist friends about you. I've never done this before." That was probably the wrong thing to say before you saw someone's tooth in half. Years ago, my then 11-year-old shattered both femurs and her hip. At the time, her orthopedic specialist was so reassuring and confident that we had no doubt about her recovery. A year later, we went back for a review and he asked me if I'd like to see her trauma x-rays. Not having any idea of the reality, I said yes. What I saw looked like her leg bones had exploded. After my freaked out reaction, I commented on how cool and calm he was, and how certain that she'd be fine. He said he'd actually had to go for a short walk around the hospital to collect his thoughts since he had no idea how he would put this child back together. He also told me he'd used the films as a teaching aid. He's one of my heroes. You're going to have to explain how one shatters both femurs and a hip, and if she's walking now. Yep. Had a patient who was 62 and he had never seen a dentist before. I am a dentist. Had literally everything going on orally, especially the smell. OMG. The smell. Me and the assistant were like, don't worry, we see this kind of stuff all the time. Not a lie, just never all at once. ORN here. So many. 1. Vaginal discharge. The color and consistency of guacamole stuck on a speculum post-pelvic exam. The patient's husband had recently been released from a period of federal incarceration. 2. The first time you smell a really funky, long-term GI bleeding into the intestines, usually the colon. Poo and blood equals murder most foul, and the patient is sometimes a sweet, incredibly sick little granny watching us gag as we clean her up, apologizing for the smell, and we have to just say, from behind the peppermint oil soaked mask, oh sweetie, it's okay, we do this all the time. 3. Dead, sloughed intestinal lining. Another smell that will haunt your damas. But the winner chicken dinner in the no number. It's not that bad. I've seen worse. Category was the homeless dude who came in complaining of blood in his urine. He wasn't able to pee more than a few drops at a time, so we used a little ultrasound machine to see how much urine was in his bladder. More than 1,000 milliliters. You just bought a catheter, sir. I tasked one of our male patient care techs with the job and had barely gotten back to the desk when he came running out yelling, I need some help. Grab gloves. I lifted the gown covering this guy's junk and grabbed the penis to help. Maggots in the urethra. And he was pee off that we removed them because, in the Corinum, they teach you to eat maggots. That's free protein, damn it. Just eating some coleslaw and chicken while reading this, no big deal. Not a medical professional, but I have impressed a couple. It's not super weird but just uncommon, I guess. I was overweight but active when I was younger and broke my lowest rib while snowboarding. Long story short, I did not know it was broken, honestly, so I never got it checked by a doctor. The rib traveled up over the next 2 ribs and has since fused to them. I now have a permanent tilt on my spine where this rib attaches to it, and now that I have lost some weight, a bump you can feel on my chest. It is kinda weird when you tell a doctor about something on your body and their face lights up like a kid on Christmas and they ask for permission to feel it. Some people really do love their jobs. Nursing corrections here. Had an inmate patient come in with complaints about severe lower abdominal pain. He told me that he had something stuck in his prison pocket. Before I could ask him what he stuck up his anus, he bends over and shows me a cord sticking out. I told him, don't trip, I'm sure the doctor can help you out with that. You'll be alright. Come to find out, the prong of the phone charger got caught up into something and it was stuck. As I was trying to comfort him, I started to hear this vibrating sound. So I asked him if he heard it do. He said, it's the phone inside me that's stuck with the charger. It wasn't just a regular flip phone, it was one of those Samsung smartphones. I sure hope it wasn't a recalled Note 7. Had a patient who had a melanoma the size of a cauliflower head on the back of her ankle. Melanoma doesn't generally grow like that. Maybe it was the ozone injection she'd gone to another country for. Had a guy that shot himself under the chin with a shotgun. He had actually done it like 16 hours prior to family finding him. He was still alive, conscious and alert to what was going on. His jaw looked like Predator. I had family freaking out, of course. Had to tell them we see worse often. Which may be true, but they are usually dead. He lived for almost a day after shooting himself, then died in the back of my ambulance. I had to drop my first nasogastric tube on a rather hysterical older teen. I was actually a very experienced nurse, but just had never had the opportunity to insert one. I check the procedure manual, watch a YouTube video, and walk in the room. I'm not worried. This usually isn't that difficult and I'm in general a skilled nurse. Girl is sobbing. Mom has to leave the room, she's so upset. And angry dad tells me he's a paramedic and that I better know my crap. Dad says aggressively, have you done this before? I say I can't even count the number of times I've done this. Girl says, will this damage my vocal cords? Curious question. But I'll laugh a little and say with a smile, not if you stay calm and follow my instructions. Dad says because she has studied under name I didn't recognize for years and has a full ride to fancy arts school that I did recognize. That NG tube slid in like butter. No problem. Girl did just fine. I'm not going to lie, I was sweating just a bit. Also one time some young 30-something crap out the most blood I've ever seen someone crap out and live. He was lying passed out on the floor of the bathroom while our rapid response team assembled, trying to figure out how to get this massive young man out of a rather small space. He came to, saw all the blood, and just calmly looked at me and said, "That's a lot of blood. Am I dying?" I said, "Nah, I used to work labor and delivery. I know it looks like a lot of blood, but I've seen way worse. You're going to be just fine." That was a lie. I had never seen so much freaking blood, even an L&D, and I wasn't sure he was going to make it. He lived. I'm a surgeon. A couple of years ago they sent us this guy, 52 years old, that had shown up in the ER because he allegedly hadn't pooped in a week or so. To make a long story short, X-ray showed he had something lodged in his rectum, and sigma, and descending colon, so way up there, that was a little over a foot long. He denied having put anything up there. Yeah, right. We try to go from the bottom up and nothing. We see something but we can't clamp onto it. So, what now? Operating room. Ended up opening him up, and inside the colon we see a hand. I just about crap myself. Ended up being a mannequin's arm, like store mannequin. It was stuck up there up to the elbow. That was an odd one. I'm a pediatric nurse, and triaged a young girl with a rash. Mom had been to several doctors and they didn't know what it was. I recognized it right away, called Stevens-Johnson syndrome. I remained calm. Patient was flown to a burn center, but died. I had only seen it once before and it was fatal for that patient too. We had a patient in the ER who was sick of her visual hallucinations, so she scooped her eyeballs out. She looked like something out of Hellraiser and unfortunately did not fix her hallucinations. Another patient came in with a colostomy and ran out of his equipment, so he duct taped a trash bag to it. It had several pounds of feces in it. Holy frick. That poor woman. I am so sorry you had to see that. Not even close to a medical professional, but my aunt is a nurse and told me about a guy who came in coughing up blood and maggots, and it turned out to be some worms he got from eating something that ate through his stomach lining into his esophagus and were in his throat. Paramedic here. Had a homeless guy call saying he stepped on a nail about a year ago. I could smell it from the door, so I expected it to be bad. But when I went to pick up the leg by his heel, there was just nothing there. His foot just evaporated into pus and maggots and his metatarsals clinked through my fingers. While I'm standing there trying to comprehend what happened, he just sighed and asked me to pick up his foot. "What foot, buddy? Put it back on." He said it falls off a lot these days, but it still hurts, so that's good, right? I had no clue what to tell him. The nurses thought it was hilarious that the baby medic, that's me BTW, got grossed out. Not a medical professional. My husband was born with a pretty insane heart defect that all the doctors were in agreement shouldn't have worked, and he certainly shouldn't have lived as long as he did. One called it a ticking time bomb. His heart had 2 chambers instead of the normal 4. He didn't have the big arteries that led from the heart to the lungs, but a series of smaller ones. I will never forget the first time I saw him take his shirt off and you could literally see his heart beating in his skinny chest. Literally, every beat. At the age of 25, 3 years after we were married, the time bomb blew. 7 years later, I very vividly remember his chest moving as his freaked up heart beat. I am so terribly sorry for your loss, and hope your time together was precious sex. A dog bit my little sister in the face, ripping through her mouth and cheek. It was at a soccer game. She crawled on top of a big dog called a borzoi, which startled it. It rolled over and bit her in the face. This was the late 80s, smaller town. There were no pediatric surgeons available, no plastic surgeons. She was in the ER with her face ripped open. Anyways, our general pediatrician, who is now my kid's pediatrician, 30 years later, who had only graduated maybe 10 years prior, sewed her face back together. It was 30 stitches on the inside of her mouth, and 30 or so on the outside. She had a massive scar down the whole side of her face. And fast forward 15 years. She grew normally. Her face is fine. Her smile is fine. No long-term damage. Apparently, a face is full of nerves and muscles, and that's why only plastic surgeons work on faces. Particularly with children, having nerve and muscle damage can make their face grow crooked as they age. It is a highly specialized field, but in this case, there was nobody else. just a general pediatrician, and he managed to save her face, with no long-term nerve or muscle damage, or even scarring now that she's an adult. We found out 25 years later from our pediatrician's wife that he spent an hour or so crunching his old med school books in the seat of his Plymouth Reliant in the hospital parking lot, studying facial anatomy, nerves and cheek structure, etc. He walked into the hospital and performed a multiple-hour surgery on her face, sewed it back together perfectly. You would think a plastic surgeon did it. His wife told us he came home that night, just flopped down on the couch, and sat there, amazed that he'd done it, proud, but cautious. A new general pediatrician sews a toddler's face back together, and it worked. Now, you would never know it happened, and he has never, ever, done another surgery like that again, lol. Saw a surgeon one time seriously screw up what I can only assume was intended to be a hernia surgery using abdominal mesh. By the time the guy came to clinic, his stomach looked like a shuttlecock, not on the inside. He was just walking around like that. Freaking hernia mesh. Years later it feels like a spork is stabbing me in the groin. I saw a patient with a history of crippling depression who attempted suicide by firing a bullet through his chin and out the top of his head. With surgery he survived. I followed his psychiatric neurocare over the next month and the dude was cured of his depression. His subsequent mood was like a chill hippie with an endless supply of weed and no negative effects. Whatever the bullet did on its way through his brain cured his depression and left everything else intact. I'm the patient here and the nurses didn't even try to say they had seen it before, but it still fits. When I was getting treated for cancer, I got a really bad case of pneumonia and had to be intubated and put into like a semi-coma type deal. I don't remember anything that happened in those 6 days, but I was apparently made sober enough to open my eyes for visitors every day, so I don't know if that counts as a coma. It was some pretty serious pneumonia because it was like less than 2 days between my first cough and them making the call that I would need to be intubated to stop me from drowning in my own fluids. So they didn't mess around and gave me a ton of antibiotics. You know how some hospital beds have a track along the ceiling that they can hang IV bags from? I had enough antibiotics hanging from mine that it broke and fell to the floor again. No memory of this. But the thing that was truly unprecedented occurred when they were changing out my butt bag. I don't fully understand what it was, but they had something on or under my butt that collected all my bowel movements. They put it on after I was heavily sedated and removed it before I was totally awake, so I don't really remember it. For anyone who doesn't know, antibiotics can cause a lot of diarrhea. Apparently when they rolled me on my side that day, I let loose a fire hose of liquid crap that arched through the air across the room and splattered all over the door and window, which were about 12 feet away from my bed. I think it's super cool and funny, so they didn't have to pretend like it was normal to comfort me. There are two options here. A bum bag, which is a bag that is attached to your bottom via a very sticky, waterproof seal that collects all your feces. Or a flexi seal, which is essentially a tube that goes into your anus and allows liquid feces to drain down a tube into a bag. So you either had a tape stuck to your bum or a butt plug poop tube. Both are fantastic devices. Doctors of Reddit, what's the most incorrect patient self-diagnosis you've seen? Late to this, but my friend has an incredibly tough, alcoholic grandma. She ignored a stroke because she thought it was a hangover. Dang. That grandma must have had some rough hangovers. Saw a patient last night who had been having episodes of wind for 6 months and had come in because of a particularly bad bout. Massive heart attack with crescendo angina over the preceding year. Not that uncommon a self-misdiagnosis, but kind of takes you aback when you see it. Fart attack. Not a doctor myself. My grandfather was a doctor and had a patient come to his office complaining of a slight headache. His receptionist told him to wait in the waiting room. They called his name, but the guy never came up to the desk. He actually suffered a major brain hemorrhage, died waiting to be seen in the chair. Dang, that sucks. So close to help yet so far away. Man who rode his bike, a sole method of transportation, came in for chronic knee and leg pain. He had metastatic prostate cancer with bone lesions all over. Came in for my legs hurt, left with hospice referral. As a paramedic, I responded to a dispatch for a sick person. When we arrived, this old guy was clearly having a stroke. He said, I just ate some bad fish or something before taking a 3-hour nap. Luckily his wife finally decided to call 911. That would have made a funny tombstone though. I just had some bad fish or something. I personally knew a guy who was diagnosed with lung cancer in college at the age of 22. He was so young and lived a clean life, so it was confusing to everyone, even the doctors. They progressed very quickly with the treatment, and he was scheduled to start chemo. He was doing some sort of pre-diagnostic meeting, and an intern was involved. The intern started asking some very different questions, and he eventually asks the patient if he had been in Kansas recently. It turned out he had, in fact, spent the previous summer working in Kansas. This was a few weeks after. It turned out the intern had been writing a paper specifically about localized diseases, and there was this disease in Kansas that he had focused on. It had something to do with hay, but it wasn't hay fever. The intern was basically telling the doctor to humor him and run this one specific test. The doctor agrees, and the test comes back with results that show the intern was onto something. The patient went in for chemo treatments with a grim outlook, and he left with 10 pills he had to take over the next 5 days. 1 week later, he was completely fine. For what it's worth, this was in the year 2001. Not a doctor, but a psych first responder. Patient self-diagnosed as dead. EMTs didn't believe him. He was quite insistent though, and wanted an ambulance ride because he thought a dead person ought to have one. The EMTs argued with him, stating that he was both standing and talking. He countered that he was in heck. In fact, he was just pretty high with a bad drug combination. I had a fun hour with him while he came down. As a medic, I had a soldier run up to me and demand to see the PA. When I asked why, he said his girlfriend has BV and now he's sure he does too. I assured him that he most certainly did not have bacterial vaginosis. I'm not a doctor, but I am a medical professional at a hospital. Patient came in stating that he had blood in his stool for almost a year and was convinced that it was just because of hemorrhoids. He only came in when he started to get abdominal pains. Turned out to be colorectal cancer. Moral of the story is, if you have blood in your stool, especially dark colored, don't ignore it. I have had an unbelievable amount of patients who think they have Stevens-Johnson syndrome. Thanks WebMD. When they in fact have contact dermatitis from new lotion or laundry soap. I also advise not looking up that condition. For anyone curious, SJS basically makes your skin fall off. 10/10 would not Google again. Elderly man with dementia brought in for suspicion of toxic epidermal necrolysis, a serious and life-threatening reaction where your skin peels off in sheets. Nope. It was a very large burn because they left grandpa alone at the house and he spilled a teapot on himself and the family, and another hospital were too dumb to figure it out. Tale as old as time. If I had $1 for every patient who thought dermatitis from laundry soap was SJS, I wouldn't even have to work anymore. I was rushed to the ER as a kid because I woke up and my face was blue. Obviously my parents thought I wasn't breathing. I'm 8 or 9 years old, and everyone's sudden change in demeanor is making me a little scared, and I'm just getting bluer. At Emerge, they're running all kinds of tests that aren't showing anything wrong with me, until finally my dad realized that I put the brand new Toronto Maple Leafs pillowcase I just got on my pillow. Washcloth later, I was all better. At least it was a really nice blue. He had some belly pain and thought he had a UT. Also had weight loss, night sweats and some other stuff. He had terminal pancreatic cancer and 2 weeks later he is delirious and at death's door. I want to upvote you and downvote the cancer. I'm so sorry. Not a doctor, but I am a nurse. I recently had a patient who claimed that he used to have diabetes, but Jesus cured him of it. His glucose was nearly 300 on admission and he was in the hospital for an amputation of a gangrenous toe that didn't heal because of said diabetes. I'll never forget the doctor's note that said patient had a history of diabetes but states Jesus healed him of that, but since his blood glucose was 289 on admission we will treat him as if he were a diabetic. I'm not a doctor but I am a medical assistant. I did my preceptor at a kidney and hypertension center. Had a guy come in complaining of painful urination and thought he had a UT. Gave him a cup and told him to pee and set it in the window. The lab took the cup and immediately brought him back to a room. which was strange. BC, this place stayed packed and it was all first come first served kind of thing. Well, this guy went back. BC, there was blood in his urine. A lot of it. This guy was beyond 300 pounds BTW. Just massive and extremely tall. Doctors got him in the room and stayed for maybe 15 minutes before we had him transferred to the ER. Apparently, he had a fractured penis and had no idea. The nurse above me said they lifted his gut and his entire groin was purple and black and his penis was at a weird, swollen angle. She said she'd never forget it for the rest of her life. The guy never did tell us what happened or anything. He acted just as surprised as everyone else. TLDR, UT turned out to be a broken dong. I would say after a couple years working in an emergency room before and during medical school that by far the most common egregious self-misdiagnoses involve pregnancy. Tons of sexually active patients coming and complaining of morning sickness and gaining weight, and just sure they have some sort of GI issue or infectious disease. When it comes around to asking questions, oh yeah, come to think about it, I haven't had my period in 3, 4, 5 months. That's not to mention the people coming in fully in labor and delivering in the ED. Truly shocked that they were pregnant at all. Now I understand people can have irregular periods and there are many cases where the patient is reasonable in not guessing what's going on. But there is a large group of patients who missed a lot of obvious hints. Denial ain't just a river in Egypt, I guess. And I do have empathy for patients in situations where they really don't want to be pregnant and so perhaps are subconsciously blocking it out of their mind. But a medical mystery it is not. Not a doctor but is somewhat related. This one night I started getting some excruciating cramps that were so bad I had to wake my mom. She asked me where the pain was and I pointed out the right side of my stomach and instantly she tells me to get in the car and we go to the ER. She thought I had appendicitis. We get there. I'm hooked up to morphine and they get an x-ray. I didn't have appendicitis. I just had to crap real bad. Opposite here. Woke up and asked my mom to go to the ER for stomach pain I'd been having for hours. She said no, it's rude to go to the ER with a tummy ache. We finally went in the morning. I would have done the told you so dance if my appendix wasn't killing me at the moment the doctor announced my disclaimer. No two people, a good friend and my sister's fiance, who complained of backaches, like they pulled a muscle. Pancreatic cancer, went from pain to them passing away in less than 90 days. This thread is giving me paranoia. I once thought I had a perforated colon because my poop was bright red. I spent an hour on the toilet in pain googling symptoms and then I remembered I got high the night before and crushed a bag of flaming hot Cheetos. You swear you're crapping out your intestinal lining, then realize it matches your fingers. Okay, so why do you think you have glaucoma? Well, back in 2002 I got shot right here, and it was a Glock. I'm not creative enough to make this crap up. Okay, that's amazing. Like it's borderline dad joke. I had a very nice gentleman come to the ED with severe weakness, going on for weeks. It all started with chest pain a couple of months earlier. He thought he was having heart trouble, and he knew you take aspirin for a heart attack. So he took a couple aspirin every day for the next few weeks. The pain got worse, and also started affecting his legs while walking. Then the weakness started. Then he pooped blood, a lot of it. That's what prompted the emergency department visit. When I checked his labs, his HGB was in the 4 range, which is low enough to make me raise my eyebrows. Normal is 13-15. You'll start feeling weak, tired around 10 usually. So his symptoms, including chest pain, weren't from heart trouble, they were from severe anemia. Turns out he had a small bleed from his colon, and taking aspirin, which thins your blood and makes you bleed more, turned it into a large bleed. So I get him tanked back up with blood, we do a few tests including a colonoscopy to see why he was bleeding in the first place, and whoops, we find locally advanced colon cancer. Thankfully it hadn't spread anywhere, so he eventually ends up getting surgery and chemo, and last I checked he's doing great. So this guy was incredibly lucky. By misdiagnosing himself with coronary artery disease, he took a totally inappropriate medication, which caused a side effect that set off a chain reaction that led him to me, and his diagnosis with cancer at an early enough stage to be cured. If he hadn't taken that aspirin, that cancer could have sat another year or two undetected and continued to spread, at which point it would have been incurable and he'd likely be dead right now. A wrong self-diagnosis that turned out to be a good thing. We don't read those very often. When my husband was 8 years old, he complained about having intense pains in his stomach and became so lethargic that he couldn't be woken up. His doctor said there was nothing wrong and that he had growing pains for 2 years. It turns out his gallbladder had stopped working and would only function correctly a few days out of the month. After the doctor refused him a referral to another doctor for a second opinion, his mom took him to the emergency room and within 15 minutes he was going into surgery to have his gallbladder removed. To top it off, they jam-packed him with so many pain meds that he became so constipated and he couldn't use the bathroom for 2 weeks. He complained about his stomach hurting again and the nurses never once asked him when his last BM was, claiming that they forgot. He had to receive an additional surgery later that week in which he had 15 pounds of fecal matter removed from him. Talk about a crappy time. I forgot to pay the hospital bill. Not a doctor, but I did this to myself once. I was in high school, walking to class when I got a sudden sharp pain in my foot. I was running late and didn't have time to deal with it right then, but I only really felt it while I was walking. It faded quickly when I was still, and even then it was minor enough that I figured it would go away on its own. After a couple of weeks of dealing with it, I mentioned it to my mom, who thought it might be gout. I was a really lazy kid, so it was a definite possibility. We go to the doctor and he does an x-ray and it turns out I broke one of the bones in the ball of my foot. In short, I broke my foot and tried to walk it off for 2 weeks. Pediatrician here. A lot of parents come in thinking their child has cancer because they won't eat anything. Actually, they just don't like vegetables and are eating themselves to obesity with the crap you substituted with. Or the parents never learned how to properly cook vegetables and make them not taste like plain butt. I didn't like most vegetables until my sophomore year of high school because that was when I learned how to cook them myself and actually use, gasp, spices and crap. Physician assistant that works in the emergency department here had a woman, around 45 years old, come in with her mother for a complaint of a spider bite to her back. It was actually an abscess. No big deal. That's pretty common. People think abscesses are spider bites all the time. I incised and drained it and sent her home on antibiotics. Pretty standard procedure. I told her to come back in 2 days for a recheck. When she came back it was looking better. She and her mother thought it was something serious because it still wasn't all the way gone yet, but it was healing well and there wasn't much to do. She and her mother came back again another 2 days later and told me it was definitely gangrene. I tried to reassure them, but they both kept arguing with me that I didn't know what I was talking about. It was obviously a healing abscess and was looking a lot better. Looked nothing like gangrene, which they had googled. Had to get 2 of my colleagues to come in the room to reassure them, but they still didn't believe us. Think they ended up going to another hospital. TLDR, woman came to the ER 3 times for an abscess she thought was gangrene. Not a doctor, I was the patient. Got incredibly drunk one night and decided to finish off the night with an amazing Taco Bell feast. Woke up the next morning with an incredibly bad stomach ache. This continued for about 3 days and I was constipated the whole time. My roommates, all pre-med or nursing, thought it was just the Taco Bell causing some issues, but on about day 4 I couldn't take it anymore and had one of them drive me to the hospital. He continued to call me a B and said they are just going to tell me to take laxatives. While at the hospital they noticed my appendix was incredibly swollen and about to burst and was rushed into surgery. On my way to surgery a doctor came running and screaming to stop and he showed the x-ray to the surgeon and they decided it wasn't the appendix that was the problem but my intestine. Somehow my colon folded into itself like a sock and causes incredible swelling and build-up. Ended up going on antibiotics and morphine for a couple of days and got to miss all my exams. Other than anatomy, the dickhead made me take a longer, more difficult, and extended response-only exam. I have no idea how this happened and the doctors tried explaining the possibilities but I was too fricked up on morphine to understand. I remember them asking me if I recently went to Haiti or the doctor. About 3 years later I started to have similar pain and went to the doctor immediately and this time they just took my appendix out. TLDR. Thought I was constipated from Taco Bell. Doctor said my appendix was about to burst. Then another doctor stopped me from going into surgery and said my intestines folded into each other. That sounds incredibly painful. Missing exams is just a cherry on top. I may have told this one before. Morbidly obese lady terrified she had a lump in her breast. Demanded to be examined immediately. Rib. Schizophrenic guy thought his lungs were rotting, but it was okay because he'd just get a new torso from NASA. He's not even American. I don't know why NASA would give him said non-existent torso. Also, I'm not really sure what sort of official organization would give out torsos, but I'm not convinced a space agency would have been my first choice if asked. Psychologist here. Saw a leathery woman who drank 3 pots of coffee a day to cure her anxiety. Wish all problems were this easy to fix. My grandpa was drinking 6 pots of coffee a day in his late 40s and started having heart problems. It was skipping and he felt weird. Eventually the doctor got him to cut down to 1-2 pots a day. Mother brought in her 3rd child. Kid's listless, pale, muscle tone is poor. Mother claims kid has MS. So doing my checks asking about food and home environment. Mother tells, oh little kid is lactose intolerant so we only us almond milk. Run a panel. Not only is the poor little 2-year-old not lactose tolerant dumb, but mother has been starving his poor brain of nutrients by feeding him only vegetables, but no protein or protein based items like legumes. Kid is developmental delayed because she saw an internet article on it, ended up calling CPS on the bee, and having all of her 3 children removed. Had a daughter with bulimia. It was horrifying. Still pisses me off when I think it about. Good on you for calling CPS. I'm not a doctor, but when I went to see a physician a year back for my shaking problem, I have severely shaking hands. I was told that it was a short-term problem that would likely go away in my late 20s. I told him I was on medication, and he dismissed it as an unrelated issue. Recently, I went to a different doctor. He assessed my symptoms: jolting limbs, twitchy face, shaking hands, locking jaw, etc. Turns out I have tardive dyskinesia, which is a very rare side effect of one of the medications I was on. It is irreversible after age 25. If I had listened to the first doctor, I would have permanent brain damage as young as 25 years old. Not a doctor, but I went to the hospital about 5 weeks ago with what I thought was testicular torsion. I got told it was orchitis and was prescribed antibiotics for a week and was told it would feel better within days. Pain got worse and so did the swelling. Turns out it was testicular torsion and was operated on and sent home without my left testicle because the doctor was so certain it was just an infection and didn't feel it was necessary for me to have the appropriate scans to double check. Which I'll later get told that it should have been the first thing he should have done in the first place. So now I'm 20 years old with a missing testicle and about a week now from full recovery. Frick you Dr. Singh, you incompetent Wankstein. Well, now others can avoid him. Thank God he doesn't have one of the most common last names in the world. Not a self-diagnosis, but I had been seeing various doctors for months with what they thought was post-viral syndrome or depression depending on how the doctor felt that day. Then after being out in the sun one day I developed a malar rash and my husband decided it looked like something he had seen on a medical program called lupus. Doctors laughed me and him out of the consultation room for months. I was too young, not the right race, no family history etc. etc. Turns out they decided eventually to order the right blood tests and I have lupus. I do love doctors, but realize now that often their guess is as good as mine. Ever since house, people self-diagnose lupus a lot. Congratulations on getting it right. Not a doctor, but a doctor diagnosed my wife with a STD. Chlamydia maybe. Huge fight. Wife was emotionally crushed. She accused me of cheating. Fricked up. I punched her symptoms into WebMD and told her it was probably kidney stones. Turned out to be kidney stones. No a doctor but a pharmacy technician. Had a patient yesterday tell me they went to urgent care and the nurse diagnosed pink eye. The patient didn't feel right about that and went to the eye doctor. Eye doctor told her she had an ulcer on her eye and if it went untreated properly she would lose eyesight and possibly the eye. I went in a boating trip off the coast of BC. We went through various small channels of water and docked somewhere where we could go kayaking on the open water. We took turns managing various aspects of the ship, doing menial tasks such as watching for logs or otters and crap in the water that might frick up the propeller, or helping out in the extremely loud engine room. This was over the course of maybe 3 weeks. On the last day of the trip everyone started to get seasick, myself included. We flew home the next day, and when we landed I felt fine. For maybe 2 hours waiting in the airport and driving home I started to feel worse and worse. To the point where I was laying in the back seat of the car and we had to pull over maybe 50 feet from my house to let me throw up. I had migraines before and it felt just like one. Fast forward to later that night and it was so bad, this migraine, that even the little light coming in from the slit under my door caused incredible pain. We went to the emergency walk-in. The whole time I was there I had to have my right eye covered or the pain would overtake me. They prescribed something, I can't remember which, but it had no effect at all. The next day the pain was still there. So bad during the day that I actually tried to claw my eye out whilst trying frantically to get a hold of my parents to take me to hospital. Once they finally took me to hospital they admitted me and took me in for a CAT scan. They found that I was suffering from sinusitis. This sinusitis had led to pressure on my optical nerve, which in turn caused a blood clot to form. I was in hospital for 2 months, under strict quarantine whilst the doctors pumped me full of blood thinners and an antibiotic concoction that they made that killed all my white blood cells. When released, they had me outfitted with a pump that pumped medicine through my arm and directly into my heart through a vein. I don't think anyone could have caught that diagnosis from light sensitivity and a headache, but I'm awfully glad I went to hospital, and that the children's in that city is one of if not the best in the world. The trip itself cost about $8,000, and the treatment probably far more. Thank God I live in Canada. I fell rock climbing directly on my knee, immediately went to the emergency room. I knew it was bad, where they took an x-ray and told me I dislocated my knee and that I might have a small fracture, but it didn't look like a big deal, and to go to an orthopedic in the next week or so. No prescription. They suggest I take Tylenol for pain. I went to an OS later that week who immediately put me on painkillers and got me in for a MRI the next morning. Went back the next day and I had a very seriously broken tibial plateau, basically where shin meets the knee. Completely torn my ACL, PCL, LCL and meniscus. He rescheduled a surgery to get me in ASAP to place my knee with a plate and 8 screws. Had another surgery 6 months later to fix everything else. My medical moral of the story is generally if something feels really wrong, something is probably really wrong. Doctors of Reddit, what was the craziest case of patient paranoia that you have ever seen? My father was a doctor, dermatologist. Had a patient who accused him of prescribing a non-existent experimental drug for a supposed condition that he was never diagnosed with. Tried to take him to court and lost. Sent a threatening letter after. Reported to police. After the police confronted him about it, he dropped a homemade fruit basket with a single bullet on top of the fruit at the front step of the office, addressed, but not postmarked, to my father with a creepy and signed apology note. Basket was immediately shown to police. About a month later my father received a letter from the guy stating he had seen my name in the paper sports section, local golf tournament results, and that he knew I would be playing at an upcoming tournament where the start times were published. There was a police presence at the tournament, something that never happens, because my father reported it. My dad's nurse's husband was a local detective and pretty much followed me the whole day with my dad. The police found the guy in the parking lot unarmed and he was arrested, then eventually committed to a psych hospital for some time. There's still a restraining order against him to this day, but this was over 15 years ago and the guy seems to have disappeared. I didn't know any of this until about 5 years ago, but I remember my dad having a single bullet in his bedside table even though he never owned any guns. When I asked him about it, all he would say was someone gave it to me. Former psych nurse here. I once had a patient who believed he was Satan. Since Satan was nude, so was he. He spent much of his time in a private, secure room, and when it was time to go for some fresh air around the unit we had to bargain with him to wear a robe. Not a doctor, but my grandfather had Lewy body dementia. Unlike other dementia, Lewy body has a strong hallucination component. Here are a few of my favorites. My grandma was having an affair with the pharmacist. She was also running a W house, which would be okay, but she wouldn't give him a cut. The Shadow Men had built an exact replica of his house, but on wheels, to use as a brothel, naturally, and were stealing his electricity to power it. That's why his switches, which powered outlets, would flip and nothing would happen. They had also dug in a basement under his house which he attempted to access one night by cutting a hole in the floor with an axe. If he took anyone looking for this alternate house, they would move it to make him look crazy. The staff at the care home he eventually was placed in was treating all the food with embalming fluid, so he couldn't eat it. He also had another doctor tell him that the medications he was on were us poisoning him and that he didn't need to take them anymore. It was a roller coaster. Not a doctor, but I work with elderly people prone to delirium. We once had an 80-year-old academic at our institute. I think he was some sort of professor and obviously well spoken. Also mostly appeared to be very lucid at first glance. For months, he'd harbored the idea that he was at the center of an elaborate ritual conducted by a medieval sort of witch. Because of her spells, he would constantly phase in and out of consciousness, imagining to smoke a pipe and talk to people that weren't there at all, etc. He further claimed that he had found that there were pentagrams drawn in lemon juice and goat urine all over his apartment. His mouth was constantly deathly dry, because she would fill it with the ashes of cursed scrolls and parchment. The witch planned to extract something from his body to create a flying ointment or something for her broomstick. Anyways, it was absolutely wild and nonsensical. The crazy thing was, his delusions turned out to be warranted. It was later found that his granddaughter for months had actually tried to poison him with incrementally increasing doses of belladonna extract. Well, in the medieval times people believed that witches could fly only if they put a flying ointment, usually made from human flesh bones, on their broomstick. And the stuff about goat urine, pentagrams and ashes are also historically accurate. So, his delirium made sense, from a mythological point of view. Psych nurse had a patient that thought that the queen was a lizard person who swapped his penis with another one. Also had a patient who thought we were drugging the air through the vents. Oh, and someone who thought his cat was spying, stalking him for Trump. To be fair, his cat was probably spying on him. Student nurse here, but I still go to the hospital for internships. Had a patient come to the ER with really high blood sugar, type 2 diabetic. I asked her if she was taking her medications and she said that she didn't want to, thinking she was referring to some type of bad side effect. I asked her what medication she was taking and it was diabinase, chlorpropamide for those of you who aren't Brazilian. Pretty standard DM2 medication. Not a lot of bad side effects other than some skin rashes. I asked her why she wasn't taking the pills and she said, look at the name. I can't take something that has diabo, devil in Portuguese, in the title. If I have to go, I shall go without any contact with these devilish chemicals, like the Lord intended. It was hard not to laugh at that one, but I kept my crap together. Not a doctor, but I scribed for one. A patient of ours was having hallucinations where a helicopter was chasing him. He'd randomly hear helicopter sounds throughout the day and felt like he was being spied on. Turns out he was ingesting too many edibles and smoking too much weed. Once he cut down, the paranoia stopped. Well, that was easy. Not a doctor, but I used to go to a nursing home to visit with people. I had an elderly lady call me her grandchild. That wasn't uncommon even for those who were completely lucid. I had many grandmas and grandpas and she was my favorite. She was very sweet and funny. She seemed to only have the occasional lapse of memory. At least that's what I thought. One day I was in her room watering her flowers. She asked me how I really was. I said fine, but she then whispered, I don't think they can hear us unless there's some device in the flowers brought. I was confused but said nope, I'm fine. She loudly said my real name and that she was happy to see me. Then she grabbed my arm and pulled me in and called me Anna, not my name, and said she could get me safe. Then went on this whole thing about them capturing me and bleaching my skin. Now she was black, I'm white. She asked if my skin was burning and not to worry because I wasn't patchy, so I could pass for a white woman and that I could still get a husband. She was worried about my children, which I didn't have any. She gave me crackers because she was worried that I didn't have food. I don't know if she had been stockpiling them for a reason, but they were the kind they occasionally got with dinner. I honestly didn't know how to respond. I was 15 and very confused. I think I smiled and tried to tell her I was safe. It was a very weird and sad at the same time. I'm not sure what she went through in life, so it could have been some kind of memory. Anyway, after that day she would occasionally call me Anna, give me crackers, and ask if I was safe. Most of the time she would call me by my real name, until about 6 months before she passed, and then she really didn't recognize me at all. Paramedic. Had a guy refuse an EKG for his 10/10 left-sided crushing chest pain because they caused heart attacks. When I asked him why he thought that, he said all of his friends who died of heart attacks had one, and that he was wise to our EKG conspiracy to give people heart disease and raise money for Big Pharma. That's a pretty brilliant variation on the hospitals kill people delusion. When I was going through EMT school, there was an old woman whose legs were basically rotting off and she was dying in the air. She was convinced she was in Germany and that we were literal Nazis torturing her. I had to hold her down while a doctor stuck her or something. It was pretty crappy feeling and not even the worst thing I saw that night. Had a similar experience with an elderly lady in IQ. It is so disturbing because she was so convinced we were torturing her. I'm an scribe. The most paranoid patients I've seen are the ones who are very, very high on M. Usually it involves them believing that bugs are crawling on or out of their skin. Don't do M or H. Those drugs are bad. MK. Not really paranoia, but delusion or dementia. My mum used to work in the office on a psychiatric ward. One of the patients would come to the office window every single day, ask for a bus ticket and pay for it with a penny toffee. They would pass him a raffle ticket and he would spend the rest of the day sat on a bench in the reception area waiting for a bus. Every night after he went to sleep, the staff would put the penny toffee back on his bedside table. I always thought it was really sweet of them to keep up the charade. Paramedic here. Not the craziest, but the one that always gives me a chuckle. I was transporting a paranoid schizophrenic patient who kept shouting at me that I was an agent of the government who was out to get him. I couldn't really disagree with him as I was a government employee and I was there to get him. I'm a paranoid schizophrenic myself, and I'll totally remember that if I ever become psychotic again. In all honesty though, it's terrifying when you can't tell delusions from reality, and it makes it even harder when there's coincidences like this that confirms what you're believing. Not a doctor, but this is what happened to me. Had been experiencing psychosis for years in hindsight, but it came to a head about 18 months ago. I eventually went to my doctor who referred me to a psychiatric nurse, who prescribed me antipsychotics. For a while I was convinced there was nothing wrong with me. Even the thing that followed me around told me I was making it up. I realize now how ridiculous that is, but I was convinced at the time. And that my pills were placebo pills, so that if when I went back to the nurse and said they were working, they'd tell me they were fake pills and I must be making it up. I stopped taking them for a while. That's the thing with mental illness, the pills work so you feel better, so you stop taking them. Then you go a bit mental again and started to get symptoms again, so I'm very happily back on them. I am glad that you are back on them and I hope you are doing well. I know someone who has schizophrenia and bipolar disorder and sometimes goes off their meds. It's heartbreaking. Not a doctor, but had a geriatric patient with Lewy body dementia. She was married with kids but was in constant fear that the FBI prison truck was there to pick her up and take her to the lesbian prison camp. Lesbian prison camp is a great band name. Not a medical professional. However, I work in an ER. One patient stated that she needed to stop the destruction of the world as aliens were coming to take everyone she loved. She stated that at midnight if she didn't get to a certain park, we're all fricked. Nurses sedated her as she began to hurt herself, slamming head into the wall. My wife is a clinician and had a person come in with the idea that Donald Trump's Twitter feed it was actually an alien artificial intelligence that infects everyone who reads it. I really like that one. Not a doctor, but one of my close family members is. A lady came in with her infant, 12 months, indicating that the government was going to take her baby away if said infant didn't get the heart surgery the baby needed, because they would think she was neglecting it. She had visible signs of self-inflicted injury and, I forget the name of it, but the one where people rip out clumps of their own hair and eat it. My family member treated the baby. When I say treated, I mean, they did the rundown on the baby and verified that it was in good health. Social workers were called with respect to whether there were any orders out or issues regarding the welfare of the kid, and nothing. The kid wasn't on anyone's radar for social services, or any of that. Then things get interesting. Police show up. Husband had called the police and said wife was acting erratically on the phone, but when he got home, she and baby were not there. I gather police protocol normally involves checking hospital admissions so people get found quickly. Wife subsequently failed, both with officers and physicians present, to correctly identify day of the week and current location. I'm gonna omit the whole after story, but the end of the story is just that a couple months later, husband, baby, and wife mother are all happy healthy, and it's about as positive of an ending as an acute mental health incident can have, given the circumstances. I would put this in the paranoia category just because this woman was so afraid to go to heck due to her religious beliefs that she let herself die. Lady went into labor and post-labor started hemorrhaging. She needed a blood transfusion but was a Jehovah's Witness and refused treatment. She died as a result. I was raised a JW, and yeah, that crap whack. Something about how blood is sacred. Many people have either died or almost died due to their refusal to accept blood. It's mostly concerning for children who might need a transfusion, and the JW parents not allowing them. That was always my fear growing up, at least. Not a doctor, but I was convinced that my ex is communicating with me through static electricity. I straight up confronted him about it. Not a doctor, but I worked for a luxury watch company doing repairs. One client was 100% certain that we installed a tracking device in her watch. Came back repeatedly to have it removed and got the police involved. It was actually really sad to see how delusional this woman was. We don't want to track you, and let me tell you, there is no room for anything other than the movement in a watch case. Veterinarian here. One owner brought in his seemingly healthy cat in for diarrhea. He brought medical records from the cat's prior annual wellness exam at a different clinic. I reviewed them. Pretty standard stuff. Then the dude started going on a rant about how the other veterinarian used experimental drugs on the cat. When asked about it, it became clear the guy was unwell. He later dropped the cat off for boarding and abandoned her at our clinic. Sounds like that was the best thing for that poor cat. IQ nurse. We had an elderly woman with some kind of schizophrenia. My mental health knowledge is shocking, and she had subdural hematoma, facial fractures, fractured clavicle, dislocated shoulder. All of her fingers were broken. Huge burns to her hands, stable L5-6 fracture, some kind of fracture dislocation to her ankle, burns and open wounds that required suturing all over. It appeared from the injuries that she was significantly assaulted, but no, she did it all to herself. I'm a physiotherapist UK. I was on my first placement as a student. A patient who had a hip replacement was delirious post-OP. They were convinced they'd not had an operation, and the night after having it they tried to get in bed with another patient. After stripping off all their clothes, they threatened to get their partner involved, who was an ex-lawyer, because we said an x-ray was needed to check the prosthetic as they weren't following precautions, but the patient didn't think they had anything wrong with them. When they came round fully and was discharged, they said, "I'm really sorry, but I think I went a bit crazy these last few days." Nice of the patient to apologize afterwards. Patient's mother didn't want son to get vaccinated because she thought vaccinations created superbugs that couldn't be treated. Sounds like she's mixed up two issues: people not completing courses of antibiotics and vaccines. Not a doctor, but work on a psych ward. We have a patient who thinks he can hear his girlfriend's voice through the wall he shares with his neighbors and has convinced himself she's swinging with all his family and neighbors. This was when I went abroad to France for a clerkship in psychiatry. I had learned French in high school, hence had a horrible American accent. Once I arrived to the ward, they told me a general description of all the patients. They mentioned there was an American patient whom they had found on the streets who claimed he had escaped to France since the ISV was looking for him. When the patient heard me speaking to other colleagues, he thought I was an American secret agent coming for him. This sparked a psychiatric episode and caused great stress. Not a doctor, but I do conduct interviews in the county jail. The assessment I have to use asks about personal information, such as address, job status, income, etc. This particular defendant stated she was a mermaid. She did not know her or her son's age, as merpeople age differently than humans. She had moved to our city to receive services she could not get elsewhere, which is funny because we are a good 3 hours from the coast, and I thought she would need to be near the ocean. She would not specify the services needed. She listed her occupation as a celebrity on TV and working constantly, and only made about $300 monthly. All in all, the drugs she was addicted to really warped her reality. I currently have a patient who believes he is an undercover police officer and has been sent to infiltrate my traumatic brain injury clinic. Brain injury is interesting. The modern day remake of Shutter Island looks really interesting. Clint Eastwood has a restraining order against my father. My father is convinced Clint is his dad. He has gone out to his home and harassed him quite a bit. Had a patient who needed an orthopedic operation following a fracture. Refused multiple times because he believed he had discovered a secret in the 70s and major world leaders were out to kill him to keep him quiet. He thought he had an anesthetic that Trump or Theresa May specifically would use it as a way to kill him and cover it up. After over a week of regular psych input he had the op and it was a success. This middle-aged lady had a pituitary brain mass that had gotten large enough to push on her optic chiasm, the place where your optic nerves cross over each other between your brain and your eyes. She was totally blind because of this before she decided to seek care. She had her brain mass resected and was on a bunch of steroids to replace her pituitary function. The steroids, plus the IQ environment, lack of good sleep, plus the recent brain poking led her to become absolutely psychotically delirious. She was extremely paranoid, to the point of mistrusting everyone who came into her room. This included her family, who, since she couldn't see them, she accused of being imposters who were working for the hospital to try and trick her. One day my whole team was at a conference and got a frantic page from her nurse. We rushed back to the ICU to find the patient, fully naked, perched on the side of her bed. Remember owling, about to do some sort of WWE type jump attack in the nurse's general direction. We managed to subdue her with some Haldol, and after a few more days she started to clear up. But I'll never forget that image of that big nude Pacific Islander lady teetering on the edge of the bed. Not a doctor, but my ex thought she was being spied upon and blowguns were being used to shoot small needles into her neck. Made an interesting week. We had already broke up years before, but I was the one person apart from her mother that she trusted, and her mother had to leave for family emergency. She kicked me out about 4 times a day and then called back as she was sure now I was not one of them. I brought my laptop so I can watch at least some movies as she didn't have any entertainment system, computer or internet. I couldn't because they will be monitoring through it, so I had to remove the battery and I was still worried she would smash it to pieces. The mind of someone with good bout of paranoid schizophrenia is, well, it is entertaining in a very scary sort of way. She kicked me out one last time, did not let me in again, threatened to call the cops, and then I found she had stole the last of my money. I really did not have a choice but to call my brother to borrow some so I could at least travel back home. Good guy or girl, IDK if I would do all of that for my ex. While in the nursing home, my great-grandmother was convinced that the nurses were sneaking into the room at night and stealing her organs. She crocheted a lot, and she would crochet crosses and then put googly eyes on them and hang them around her room so that God could watch the nurses and stop them from stealing her organs while she slept. Dementia can be wild. A room full of googly-eyed crosses would legit be frightening. Not a doctor, but I had one call me because my ex-wife was displaying behavior that indicated she may do harm to herself and others. She went to her, let me count here, third ex-husband's apartment, broke in and screamed at him about how he was cheating on her. They were already divorced at the time, so yeah. After sacking his apartment and not finding anything, she zeroed in on his rosary and accused him of cheating on her with the Virgin Mary. Not a doctor, but my parents threatened to take me to a psychiatrist multiple times after I tried telling them that my older sister swallowed our pet hamster. I swear I'm not making this stuff up, but now I think I sound like a crazy person to my family. My gran had patient paranoia a few months before she died. I was around 13, so I wasn't told, but recently, as I'm studying psychosis at school, so my parents told me. Apparently, She believed that the doctor tortured guinea pigs in front of her as she was getting medication. It was really sad because I remember her being so nice and gentle and definitely not someone that could have been suffering. But we don't know what caused this paranoia as she was good friends with the nurse. Physician assistant here. Not as crazy as some other stories, but when I was in school doing my psych rotation, a guy came in looking for help regarding anxiety and paranoia. He was homeless and had a very extensive history of drug use, mostly hallucinogens and psychedelics, and he was living in a shelter where he said he didn't feel welcome. He told me he felt like people were out to get him. When I asked who these people were, he rolled his eyes and gave me a don't play me look and said, well, you, for starters. I started telling him how I was only there to help him find the treatment he'd been looking for, and he kept giving me these looks while I spoke. Eventually, he goes, come on dude, you keep drinking from your water bottle. People do that when they're nervous, and you're making me nervous too now. So I put my water away and laughed it off to try and make him more comfortable, and we kept talking. He keeps making remarks and I keep reassuring him until he goes, isn't this all a little weird? This is weird, right? You're freaking me out. He's maintaining his composure this whole time, almost smiling, and then finally he just starts laughing outright. I had been able to keep calm and maintain a professional attitude until this point, but as soon as he broke and laughed, I burst out laughing too. So here we are, sitting in this crappy office, laughing our asses off. Him because he was very nervous and me because of, well, the whole situation I guess. That was a couple years ago. Nice guy. Hope he's doing better. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.